a presentation in regards to the public health modernization consultations. And as you are aware, the membership of the Board of Health consists of members of council from Norfolk County as well as from Norfolk County. However, the Board of Health is charged with advancing public health of both Norfolk and Haldimand counties. The perspectives of Haldimand County citizens are conveyed to the Health and Social Services Advisory Committee that meets, and that membership is composed of both Haldimand and Norfolk councillors. In this context, we did invite Haldimand to join us today. However, I'm not seeing any of their councillors present, but that invitation certainly was extended. The province is conducting a review of the organization of public health services, and as part of this process, the minister has formulated a committee that is meeting with representatives from health units to understand the perspective of the committee members. So the goal of our meeting today is to discuss items that should be highlighted to the province. Specifically, they're looking for your perspectives for those meetings. In this context, again, if everybody will kind of collectively share your views with the team, but first I'll turn it over to Marlene.
Thank you, Madam Chop and members of the Board of Health. As our board chair has articulated, the objective today is really to ask you to share your perspective on the public health modernization to influence the Ministry of Health in their decision making to advance the interest of Haldimand Norfolk residents. So just a quick agenda, and Dr. Nesathuri and I will try to be quick, and then really when we get to the priority areas, want to really get some dialogue and get the perspective from the board members, which will then share with Haldimand Council as well, so that they're apprised of what we're moving forward. So Dr. Nesathuri is going to speak just briefly about public health. I will then provide an overview of the current modernization. And finally, we will seek your perspective, as I've stated, on the key messages that we want to share with the Ministry of Health and Mr. Pine during our consultative session in the next few weeks. So with that, I'm going to turn it over to Dr. Nesathuri.
Madam Chair, members of the Board of Health, we appreciate the opportunity to speak today. This is obviously a very important session because it will allow us to influence how public health programs and services will be delivered to the people of Haldimand and Norfolk counties, as well as to the province, throughout the province. So by way of background, what exactly is public health? And if I could share the formal definition, which is an organized effort to keep people healthy and to prevent illness and injury. It's a combination of programs, services, and policies to protect all Canadians. And that's a very universalist construct. But really, from a more operational, granular perspective, public health is different than the practice of medicine. It's not about the individuals that are being served. That is the role of doctors and dentists and nurses, but it's really about how we can improve the collective health of the population of people we serve. The Public Health Service does many things in Haldimand and Norfolk counties, and they can be divided into two large buckets. One is health protection, and the other is health promotion. Health protection, and I'm just going to go through some of the activities. It seems obvious to many of us, but it's at least, I think, worth at least stating. Health protection includes things like the procurement and distribution of vaccinations, the management of outbreaks and communicable diseases, and I'll comment on that a little later today. Inspection of restaurants to prevent foodborne illness, inspection of tattoo parlors, hair salons, barbershops, and other places to prevent bloodborne illnesses like HIV and hepatitis. On the other side of the coin is health promotion. Those are activities to try to minimize smoking rates. It's the menu of services that we offer pregnant women and newborn mothers and infants to improve their quality of life and health. It's advocating for the responsible consumption of alcohol and its compliance related to the statutes that govern smoke-free public spaces. So collectively, the public service, the Public Health Service tries to provide a broad menu of items as directed by rule or by statute or by tradition. And when we have this opportunity to present our perspectives to the ministry, I think your insights are particularly helpful as we're going to try to collect them together and then transmit that. So if I could return to Ms. Miranda.
Thank you, Dr. Nasathuri. So one of the areas being discussed within this modernization is regionalization. So I just wanted to share with the board once again that the Haldimand Norfolk Health Unit is one of 35 health units across Ontario as part of the dissolution of the former regional municipalities of Haldimand Norfolk in January 2001. Norfolk County, as you know, was designated as the Board of Health for both counties and is responsible to administer the public health mandates. The Haldimand Norfolk Advisory Committee was established with both county representatives to make recommendations to the board. Changes to public health and structures are not new to Haldimand Norfolk, and they're not new to Ontario, both at the public health level, the municipality level, and through the healthcare sector. So working in public service, we expect governance changes based on the priorities of the current legislator. We will adapt according to the recommendations of the ministry and Mr. Pine. So just a little bit about Haldimand Norfolk Health Unit. The Haldimand Norfolk Health Unit provides public health services in a rural area that serves 110,000 people in a geographical zone of approximately 11,000 square kilometers. The health unit is exemplary in advancing administrative efficiencies. Although the health unit is a department of Norfolk County, it provides services to Haldimand County as well, as you know. The Haldimand Norfolk Health Unit is deeply connected to the community it serves. The Haldimand Norfolk Health Unit will continue to provide essential public health services during any transition period. Our health unit is an example of an efficient regional model which already serves two distinct municipalities. Sorry?
I don't think we're 11,000 square kilometers. Haldimand and Norfolk. Norfolk's 1,600 and Haldimand's 1,200.
I will go back and check it. I cut and paste that. I will apologize. Ensure it's accurate before we go to the consultative session for sure. Why are we here today? So the board will recall that in April of 2019, the provincial budget was comprised of an announcement that the public health healths across the province would be regionalized from 35 to 10. In the summer of 2019, the regions were announced and consultation began to discuss those regionalizations. At that point in time, there were 10 regions that were announced. In the late summer of 2019, the consultation was halted. In the fall, the ministry appointed an advisor for consultation, and the appointment was with Mr. Jim Pine. The winter consultations have started, and Haldimand Norfolk was asked or invited to a consultation session on February the 11th. Hence, we felt that we needed to bring this to the board quickly to get your input. With the current situation with the coronavirus, that meeting has since been canceled, and we are waiting it to be rescheduled, at which point in time both staff and elected officials will participate in that consultation based on the feedback that is received today from the Board of Health. After that, we also with that information, we will provide a formal submission to the ministry on the position that this Board of Health wishes to put forward. The final recommendations of the ministry under the advisement of Mr. Pine are expected to be issued in late spring and then implemented accordingly. So what's the opportunity? So from the ministry's perspective, while broader health system undergoes transformation, a clear opportunity to transform and strengthen the role of public health as a foundational partner in improving the health of Ontario's was stated. Today, you, as the board members, have the ability to influence the process and the outcomes for Haldimand Norfolk Health Unit and the citizens that it represents and services. The Ministry of Health and Mr. Pine have stated repeatedly that they have no predetermined outcomes and the driver is better service. So the 10 regions that were previously presented are currently not on the table, and there are no predetermined outcomes as stated by the ministry. Additionally, the provincial government has been very clear that the status quo cannot continue. So as a starting point, based on the Ministry of Health discussion papers that was circulated via email to council or to the board, I want to share that what has been highlighted from previous reports over the past 20 years as critical challenges in health, in public health. For those of you who were around the table a few years ago, there was one paper, which was the expert panel, that we did respond to with some of the local considerations. That was also shared for your reference for the discussion this afternoon. So from those findings of some of those reviews and papers, there were 4 critical challenges that were addressed in that discussion paper. The first one being the alignment of public health priorities and related social services. So as an example, if I may, public health advocates for healthy eating. However, many simply can't afford to buy the food that they need. Public health provides Narcan. However, many times the true root of the substance use and the need for Narcan is actually an underlying mental health concern. We need to stay connected with the community and other health and social services. Being embedded in the municipality leverages many of those linkages with our partners. The second challenge that was part of the findings in the report was the duplication of efforts. There are 35 health units across the province, often engaging in similar efforts according to the Ontario Public Health Standards. Many of these efforts are duplicated and then are being done repeatedly across all 35 health units. Some examples of that would be things like tobacco prevention and the messaging that's associated with that, alcohol messaging. Inspection documents vary across all health units as they're all done differently across our respective health units. These efforts could be centralized and adapted to a local context. So there are many duplications across the province within each of our respective health units. The next one is setting priorities. How priorities are set and decisions are made are inconsistent across the province regarding public health programs and services. Often, priorities and decisions are made without complete understanding of the local context. For example, from a local context, are bunkhouses. Provincial directive to increase the frequency, as an example, without understanding of the local impact and no clear rationalization on the benefits of the increased frequency was one of those decisions that were made outside of the local perspective. The bunkhouse approach and the change in this decision, as an example, leads to also to increase resource allocations that are not funded as it is a local priority. The next one leads to the last challenge, which is the inefficient capacity across many health units, including funding and human resources. It's difficult to meet many current operational needs, especially with added needs such as our bunkhouses, as I've referred to previously. We have limited human resources, which would, in a situation like the current coronavirus, if it should escalate, the surge capacity would be limited to respond to that. There's a lack of capacity to meet reporting requirements, and as a simple example, locally we have one epidemiology, whereas many of the larger urban centers have a team of epidemiology. So with the reporting requirements, we often struggle to be able to ensure that the reporting is completed. These are a few of the challenges public health faces, and along with the system in healthcare. So, the bulk of the meeting, if I may, the Ministry of Health is looking for all of your feedback on how we collectively can improve the system. In discussion with my colleagues, we are sharing priority areas with you this afternoon for your consideration to share with the Ministry of Health, and would ask for your comments to be shared with us so that we can then share with the Ministry of Health and Mr. Pine. Please feel free to provide any other areas you wish us to add. We've identified 4, but it is not limited to 4. We would be looking for key messages to take forward. Staff will be taking notes, and the final key messages will be shared with the board and with our Haldeman partners. The first is regionalization. What does this mean? This could mean many different things as we move forward. It could mean the merging of health units. It could mean a change in governance. It could mean a change in leadership. There are many different models and structures that could be recommended. At this point in time, clearly we are not aware of what they are. There are many benefits to centralizing key functions to increase capacity and decrease duplication as long as we maintain the local services. Some of those areas of centralizations for consideration would be IT resources, human resources, and things like decision support, to name a few. So with that particular priority area, if I may open it to the floor for any questions or any discussions, and as I said, staff will take notes to help create the key messages moving forward.
Anything from the board members? Councilor, or Board Member Roberts.
Thank you, and through the chair, one thing I noticed in reading the report, November 2019, that we've been provided, is it does explicitly mention some communities that are First Nation, Francophone communities, but something that may be unique to Norfolk County is our Mennonite population of Low German-speaking folks. They are predominantly in the west end of our community, and I think it would be worth mentioning them explicitly in our response, because I haven't seen them in much of the literature that we've been getting from our friends in the province. And I think it would be worth mentioning that we have this particular community that we do service, and perhaps I missed them, but I'd be interested in hearing our staff's response to maybe the challenges in reaching this community, and what they foresee, their role, not getting lost in maybe that larger picture where quite a number of different communities in southwestern Ontario have Francophone populations, First Nations, but they may all not have a sizable Mennonite population as we do.
Through the chair to Councillor Board Member Ravitz, he's kind of stole my thunder because it's in my next commentary where we will be speaking about the unique populations within Haldeman and Norfolk and the Low German-speaking Mennonites to the tune of 5,000 is part of the discussion as well.
Board Member Huffman.
Thank you, Chair. Could you please expand, Marlene, on the IT concept in terms of the regionalization? What exactly would that entail, and what are you looking at?
So through the chair to Board Member Huffman, that could entail a whole bunch of different things, to be perfectly honest. But if we had one IT system, either from a support system, which we currently do in Norfolk County, because our IT system is embedded in the municipality, which is a great asset to the health unit. In standalone health units that are smaller, they have to have that technology and that support all on their own. When I consider it from an IT perspective, I look at the many platforms that are embedded within the health unit. There are several clinical platforms. We currently within our health unit don't have an electronic medical record. We still do a lot of manual charting and repeat charting based on that. And the systems that are across the province aren't interconnected from one health unit to the other. So in centralizing, there are many areas that IT could assist us, not just to decrease duplications, but increase efficiency, and more importantly, to have a common chart, a common platforms across all of the health units, so that we could collect data, and so that we could do many different things of transferring files from one health unit to the other. When you think of, we do have one that's pretty provincial, which is the Panorama system, which is for our vaccines. Marlene. So we've got that system. A lot of the other systems are inconsistent across the province. So there's a lot of different IT systems that, whether we're regionalized or not, that as a province, if they centralize certain systems, it would assist us greatly as we move forward.
Anything further?
Thanks, Madam Chair. When I read through the reports, just get the general sense that I don't know how to describe them, the smaller health units, such as Haldimand Norfolk, all the good things that we do is because we are the geographic size we are, which is usable. We are a community, a common community that has the same type of needs. But then all the flaws are because we're not bigger. And does the possibility exist to actually have a two-tier service delivery model where you would have the smaller units that do all the good things, but there's still that need for surge capacity, for data collection that you want on a consistent pattern, you want it on a larger scale, and sort of collectively do that at one level, and then still it reminds me a lot of regional government in a sense, right? They have two separate purposes. The one works at one scale and the other ones work at another scale. So is that an option that we could throw back to the province?
Through the chair to Board Member Van Passen, absolutely. That's a structure that the staff have looked at as well. How do we keep the local and make recommendation for some type of certain things being centralized, but definitely ensuring that the local component doesn't get lost with a more regionalized system. So absolutely, we can take that forward.
When you speak of, this might be a little bit out there right now, I don't know. When you speak of duplication and so on, where do things come into play, like when we've talked about waivers and stuff in the past, in terms of Councillor or Board Member Van Passen's favorite subject, the smoking, as an example, the smoking cessation program? Where does the duplication of those services come into play? When you look at what the province does as a whole, but yet we're being forced to deliver something that this board may otherwise, believe that our resources would be more valuable, as an example, towards the opioid crisis going on here in Norfolk County. I think the priorities of the past, when we talk about modernization, are no longer the priorities for today's current population.
So thank you, Mayor Chop. So the requirements to deliver the Smoke-Free Ontario mandates, according to the Act and according to the standards, are required by all. Where we do see duplication is that some of those standards, if you think about it from a promotion perspective, a lot of that messaging, 10, 12 years into the Act could be done at a more centralized area or a centralized promotion team, hypothetically. And then that messaging could then just be transitioned to the local health units who would just put their local spin on it, if I may. Whereas currently, right now, if you use the smoking, all 35 have a mandate. We read the standards, and then we create our own plans, we create our own promotions, we do everything individually 35 times. So that's an area where duplication and centralization would be a perfect. So we would still be required to provide the standards respectfully, but we could do it much more efficiently. In answering your question about the waivers were something that were introduced when we were looking at the funding, which isn't really the topic of discussion today, but just to clarify, those waivers were if we were needing to make reductions, were there programs that we could submit a waiver to and then basically get exempted from providing that standard that was a requirement for the municipality. So I think that's what you were asking, but I'm not 100% sure.
I mean, I didn't really mean it in the context of talking about the waivers today, but as an example, I mean, one option when you talk about modernization could be that if the province has a number of regulations around smoking, right, from marketing and so on and so forth, so they already do a lot. To me, that's now duplication at a local level. Again, I think it is maybe a little bit out there for this topic, but one idea would be that if the province mandates that you, in the same way they do in housing, they're leaving it up to the service providers to determine how to allocate funding. Should there not come a point where they could even say, okay, based on your population, you are required to spend X number of dollars on these types of programs, and you guys decide the priorities for your region, whether that's smoking cessation, whether that's, combating the opioid crisis, whether that's ticks, whether it's, where it becomes more of a local decision as to what are the key issues that are facing your area, as opposed to having the province dictate things that are, 30 years old.
Thank you, Madam Chair. Most definitely, and we continue to advocate for that. Sometimes our funding is challenged as we're restricted to funding buckets, if I may, and it's very prescriptive in where we can spend the money. But that definitely, when we talk about priority setting, that definitely is something that we can take forward for consideration. Flexibility in how we utilize the funds that are provided to us, both from the province and the municipality, should focus on local need for sure. I think Dr. Nisithuri wanted to make a statement as well.
Madam Chair, from my perspective, I think it's a worthwhile thing for the Board of Health to advocate for greater autonomy in the newly formulated public health system to set local priorities. And that's not to discount the priorities that might be set by the central authority, but because we have to think of our local context. I think that one thing that's not readily acknowledged is that the population of the people who live in the counties of Haldimand and Norfolk are also diverse. When we think of diversity, we think of urban and black and white. But if you think of one thinks of Haldimand and Norfolk, I believe there are 5,000 German Mennonites in this health district. I think there are 3,000 seasonal workers who are predominantly from the Caribbean who are also in this district, and each of them have unique public health challenges, which we've spoken about before. My colleague was telling me today that approximately 3% of our community articulate Indigenous background. So when we think of our health district, the priorities to provide programs for them could be substantively different than what would be appropriate for Hamilton or Niagara Falls or for Toronto. And the priorities set by the Board of Health should ultimately reflect the community that we serve. So in my mind, I think it's a very helpful thing when we present the position of the Board of Health that we articulate that we are different, and not in a good or bad way, but we're definitely different in this district than in more urban districts or suburban districts. So if that is something the Board of Health would like us to put forward, I think that, at least I think the professional staff would be very supportive of that.
Thank you, through you. Reading from page 1 of 15 in purpose, at the Ministry of Health, we are committed to ending hallway healthcare. Marlene, what is hallway healthcare? Dr. Necessary, what is hallway healthcare?
So, as members of the Board of Health, I know you, all of you serve concurrently as elected public officials, but we really work to be apolitical. So I believe that was a metaphor used by the Premier related to, and I think in the most positive way, to articulate the fact that patients who go to the emergency department or in the wards of the hospital many times are challenged to find the most comforting venue to get their care. So in a granular level, people go to the emergency department, they sit in the waiting room, they wait many hours on occasion, then they get seen by the doctor and the nurses and the doctors, and then they get some investigations, and invariably they, or many times, they're placed in the hallway to receive their care because there's not enough space in the wards or the regular rooms. So I think literally it means that care that's provided to patients that typically or preferably should be provided in a room is provided in an alternate venue of care. And I've taken family members to the emergency department, and I've experienced those specific issues. I think that's the literal meaning of the word, but I think the more metaphorical meaning is that the system or the healthcare system, at least from some perspective, doesn't have enough resources to meet the immediate needs of some patients. So I think that's what's being alluded to by those words, hallway medicine.
Board Member Van Passen.
Thank you, Madam Mayor. I was going to bring that subject up myself, but my thoughts that we're sitting as the Board of Health, the best way to solve hallway medicine as a Board of Health is to make sure people don't get sick in the first place. That's our purpose, right? You know, my little complaint is it costs us a lot of money when we're paying 2 paramedics and an ambulance to stand there next to a gurney waiting in the hospital. I read in Hamilton where they actually send other paramedics because they sit there for a whole shift before they can hand the patient over to the hospital. So, you know, that's a whole complaint for a different day, right? That we convince the province that as soon as an ambulance drops the patient through your doors, it's now the hospital's responsibility, and we can let our paramedics go to the next visit. But that's not the discussion we're having today, right?
You know, Madam Chair, if I could respond, it's wonderful we're having this discussion because in the decade that I've been practicing back in Canada, in Ontario, it's the first time we've had this open discussion, you know, about these issues. To the extent the public health service can have a role in minimizing the burden of patients presenting to the emergency department and other venues of care in some domains. So if we were to get our immunization rates even further for influenza, that would mean that if perhaps less people would present to the emergency department, and that mean that less people would have to wait in line for treatment, and perhaps that would free up beds and free up ambulance services and paramedic services. It's really, I don't think anyone would dispute that there are many times capacity issues in the hospital system and in the medical system. So to the extent that the public health service can focus on preventing illness, and we do that every day, well, we're happy to do that. I think that one of the things we'd have to think about, when we, at least from my perspective, is when we meet, is what would the Board of Health's perspective be related to regionalization, which is in an operational level, meaning that health districts are going to go from smaller to bigger, or at least that's the policy choice that's presented to us. My feeling is, and this is my own personal feeling, is that the patients and the public health service would be better served in some ways by having a larger, it can be better served by having larger health districts with maybe larger service area, a larger number of individuals served. Now the challenge for that is and we're going to get to that, I think, in these other 3 points, is how concurrently do we make sure that the needs of the local community are served properly and recognized. And so that's the balancing act. Like in my mind, how do we give the message that we're not opposed, at least from my vantage point, we're not opposed to improving information technology or human resource management or economies of scale related to those items, but we don't support any regionalization plan that ultimately means that selected or important priority populations are not served well or served in any diminished capacity from now. And to me, that's the crux of the debate as it relates to regionalization. Thank you.
Thank you, Mayor Chop. You know, I'll do my best to try to find solutions, but I think my whole life I've heard about the benefits of economies of scale, and I've never yet seen a bureaucracy fulfill that goal. It just becomes its own economy on its own. So I hope we're not just creating another bureaucracy, another layer that will serve absolutely no purpose and save no money. So
Thank you, Board Chair, through you. My question relates to after-hours clinics, and I'm wondering what role our board has in assisting those clinics in their operation. I know that we do have a lack of family doctors or a capacity issue with family doctors in Norfolk County, and many times those individuals that are going to those after-hours clinics, if they don't have a family doctor, their only recourse is actually to go to the emergency room. I can recall a time when I felt ill and I was in the West Street Clinic, and a Mexican Mennonite family had come in with a sick child, and they were unable to get service due to the fact that they did not have a family doctor registered with that clinic. My doctor unfortunately wasn't available at the time, but because I had a family doctor, I was able to get service. And I can remember just a pit in my stomach. I never felt so small when I said to the woman at the counter, "She can have my spot." And she had to tell me, "Ian, sorry, it doesn't work that way." And I just thought, I was so disgusted, not by her response or by her, but by the fact that our system had failed that little girl, and that there was nothing that I could do at that time to resolve it. And away they went to the emergency room with those that had maybe more grievous injuries or ailments to stand in line and kind of queue up. And so, I'm wondering in terms of capacity, and that is the subject we're discussing right now. We have a lack of family doctors. We have these after-hours clinics that many do go to because they're working throughout the day. They may not be able to take the time off, or their family doctor may not have the time to set an appointment with them. I find that in my business life as well, we're sending a lot of people directly to the emergency room. And it would appear that not very many are actually getting in to see their family doctor, and the doors are in fact shut to them at many of these after-hours clinics. And I'm wondering what would your response to that short story I've just described to you? It can be gut-wrenching for those that walk in expecting to be connected with a physician, and they're told to go to the emergency room.
So, we're here, Madam Chair, we're here to sort of think of how we want to communicate that to our colleagues in the ministry. I think that if this was the view of the Board of Health, that was a priority, we could, in our recommendation, say that these reformulated or any reforms would have to include some mechanism to improve access, quality of service, patient satisfaction to people who live in rural communities. I think that argument can be made because issues of access have historically been challenges in remote communities, i.e. the doctor is 200 miles away, so it becomes a public health priority, and that may be a distinction between a rural district and an urban district. If the Board of Health felt that it was a strong enough item, it could say that the new formulated or the reformulated or reformed public health system should have a better integration with the acute hospital and acute medical system, so these items can be addressed. In the current state, there's not a bright line, but there is a clear distinction between what are public health services that are populations, and services that are to individuals. Now, as a doctor, I always find that a challenging item because there ultimately are patients who are ultimately become populations. But in this dialogue, if the Board of Health felt that, in our rural district, that access is such a vital issue, then that can be put forth. And I think we would be happy, and Ms. Chop is going to join us at the presentation. She can articulate that as well.
Anything further?
Thank you, Madam Chair. So that's around regionalization, and I know we've touched a bit on the next one, which is maintaining that rural voice and local priority, and just to protect our non-urban interests that we've already articulated are different. We've already spoken to the different unique populations that are within Haldimand, Norfolk, of the Low German-speaking Mennonites, the migrant workers, and the third population is the 3.2% of the Indigenous population. So we have spoken at intertwined with regionalization on the local voice. So I'll just open it up to the board members. Is there anything else that you would like to add on this particular priority area, or shall I carry on to the third area? Okay.
So, we would want guidance from the Board of Health when we make our presentation. And one of the things, at least from my perspective, would be that if there are more regionalized or larger health districts, that the headquarters and the professional staff should not necessarily be placed at the population center, but more likely at the geographic center. The reason I say that is because not always, but sometimes when you have consolidated or regionalized levels of programs and services, the decision-making is made far from where many of the constituents might reside. So when we think of the local health authority for people in Fort Erie are at the very corner of this LHIN. If the Board of Health is supportive, I think that we should advocate for that position, that it should not be a foregone conclusion that the headquarters remain at the primarily urban center, especially in districts that have both urban and suburban and rural populations.
So thank you, Dr. Nursetheri. So I was going to speak to that a bit also. That's okay on the third priority, which is really around governance, and they all are intertwined. So from a governance structure, we're just suggesting that it must be structured so that, again, the local voice is not lost as a result of the population concentrations in urban areas, which are interdispersed with rural populations across the region. So what we might recommend that a formula for equivalent geographical representations for each county should be considered versus a population-driven approach for fair representation for our respective municipalities. And as Dr. Nursetheri spoken to, we should be considering the geographical location of the actual health unit if it is a regionalization or a governance that comes together. So that's around governance. Is there any further comments or perspectives from a governance perspective that board members would like to articulate? Go ahead.
So I think one thing that might be a source of discussion at the provincial level relates to what would be the constitution or composition of the boards of these new or these reformulated public health entities. And I'm not a historian of Haldimand and Norfolk County, but my understanding is that there was 2 counties, and then there was 1 county, and then there was a separation of the 2 counties, but there remains 1 public health unit, Haldimand Norfolk. So in our health district, all the members of the Board of Health are elected members of council. They serve coterminous as Board of Health members. In some geographic areas, the Board of Health members are blended, or they have some that are appointed by the province and some are elected. I think a point of discussion I think that we would want to carry forth is what type of board, what would the constitution of these types of boards of health be? And there's obviously arguments for the only officials being, or the only board members being elected officials, and there's another one to be made for perhaps a blended board. So I think that dialogue would be worth having at the meeting with the ministry.
Board Member Rabbits.
Thank you, Madam Chair, and through you. I believe that our current framework allows for good intermunicipal relations between Norfolk County and Haldimand. It's a great opportunity for both parties to have a parlay and work together to solve common areas where we have similarities and common threats to our public health. And I'm not too sure how our counterparts in Haldeman feel, but I found it very beneficial to meet that at that advisory level, to have that intermunicipal relationship and build upon it, providing that we will continue to be service managers in Haldeman. I think the outstanding question is that service manager relationship to continue with a reorganized public health unit. And until that question is addressed, I don't know how we can really advocate for continuing that intermunicipal relationship where both counties have composition on the same board, or if they are to be separated. But I found it beneficial, and with the current role that we have, I imagine some consolidation would be occurring. I doubt that in the new model that we'd be having 3 representatives from each county. It may be whittled down to 1, but that's a question that we should be asking or trying to get a finite answer on, is how many representatives would be from each county, where would we be meeting, some logistics. Right now we're currently meeting in Simcoe. It gives a chance for our Haldeman group to come down to our sort of headquarters there on Gilbertson. Maybe that location would be changing as well, right? So I think those are some outstanding questions that we would need answered. Perhaps the ministers could give us a clear direction as to where they anticipate us going. But I've seen great benefit to meeting in that way, and I'd hate for that to be lost.
Thank you, Councillor Roberts. If I may, one of the options or one of the things under considerations is the role of the governance and whether it would stay embedded within a municipality as ours currently is, or whether a standalone autonomous board would be more in keeping with the thoughts of this board and the province. So is there a particular position or any questions the board may have that you would like us to take forward on how you would like to see it moving forward? Despite the size of it, would you prefer that it would be an autonomous board with an autonomous governance, or would your preference or thoughts be that within the municipality is the approach that this board would like to take moving forward?
I will offer the opinion that it depends on the model. The reason that the Board of Health for Haldeman Norfolk seems to be efficient, is because we're interconnected. So we have access to that surge capacity within the county employees that are not necessarily employees of the Board of Health. We have that shared sources for HR, for IT. That's why it works. If you're going to expand it sort of beyond that geographic size, beyond that sense of community, it makes no sense to try to have one municipal council run it, because you lose all the benefits, and at that size it would need its own IT department, its own HR department, its own capacity for surges, which I don't know what they do when there was no surge, but that's how bureaucracies work. So depending on the model, an autonomous board, but if that's the end result, maybe it needs equal representation from every municipality, not based on population of those municipalities, but that every municipality has a voice, whether that be appointed or one of the elected officials, whatever, but that a smaller community of 10,000 would have the same say as a Hamilton at 500,000, because the needs, even though they're going to be different in those two communities, are still just as important and equal.
So the final priority area that we have there is really around boundaries. And if there were potential mergers, and as Councillor Van Passen has stated, we really don't know what this looks like, right? So, but if there were mergers, we're recommending that the Board of Health should be empowered to self-identify which mergers or whom they should merge with versus being compelled to align with health units so that we're able to identify who we wish to merge with common priorities and common interests. So that was one of the other areas. So just if anyone wants to comment on that.
Thank you, Chair Chop. I think so much of this conversation comes down to this piece here. Like, we don't really know what we need to look at until we know what our region is going to be, where how we maintain that rural voice, if we're with all rural municipalities, isn't as serious as if we're all of a sudden stuck with Hamilton. Then getting into Norfolk County has one representative on the board, and so does Hamilton, instead of being population-based, but whereas if we're all equal municipalities. So I have a question. Have you had a chance to speak with any of your colleagues in other rural municipalities to see if they are going to be pushing towards the self-identified borders? Because that's where I'm leaning. I think that the rural municipalities really need to be able to draw our own borders.
So through the chair, there are several discussions across the province where people are self-identifying or having some conversations. So the answer to that is yes, nothing has been confirmed. And I appreciate what Board Member Taylor is saying about it's hard to know when we don't know what our regions are. It was easier almost when we knew that we were going to be, one of 10, and this was the 10. The opportunity here this afternoon is though, what do we want it to look like? So that, it's kind of chasing the dog, right? Unfortunately. But this is your opportunity to say, we don't want to merge with anybody. This is what we want. We'd like to be self-identify who we want to merge with, or what are those components, because it's that feedback that's going to ideally influence the ministry to provide the recommendations in late spring. So it's kind of a little bit backwards, but it is your opportunity, and it doesn't fit nicely because there's so many variables and so many options that are being presented.
So I think it's pretty safe to say that things will change with how the tone of this government's been. So I think our position shouldn't necessarily be that we need it to stay the way it is. I think we should really be pushing for that self-identified boundaries and who we want to merge with. I think that would be the most important step forward because maintaining the rural voice is what we're really here for. So I think that would be the most important step moving forward, is to really fight for that.
Thank you, Madam Chair. That being said, I have looked at a map of Ontario, and we have Toronto, we have Hamilton, we have London. So Norfolk probably is in a position where, if we could self-identify, that would be an option. Do you want to go left or right? But that's about it. If they want to get down from 35 to 10, you can sort of draw the circles around the base of population in 10 areas, and that's where you go. But we're in the middle, right on a bubble between two, so we might have an option, but I'm not so sure what we're going to get. We're going to be told, I think, where to go, so figuratively and literally.
But to Councillor Taylor's point, though, if you wanted to maintain that sort of rural characteristic of the newly established region, you could say that it would be more appropriate to amalgamate further west along the lakeshore, even out towards Windsor in smaller municipalities, as opposed to amalgamating with Hamilton or with London, which would end up being the predominant voice.
The flaw to that, if you drive from here to Windsor along the lake, how many hospitals do you pass on the way through?
It's really a question of hospitals, though, is it?
They tend to go together, though. Medical care and...
Madam Chair, I think that from hearing the dialogue today, I think that we can make a very good advocacy position. I think it's rooted in practice and in science that if the health districts are going to be reformulated, that they should be reformulated in a way that recognizes the rural or the non-urban constituency and the local issues associated with that. I personally don't think that there's a numerical number there's an we're here to give our advice, and surely services sometimes are easier to provide in denser areas, and sometimes it's easier to provide in rural areas. So I think that that we may be able to articulate this boldly and say that the Board of Health believes that the Board of Health supports many of the key constructs, i.e. trying to improve efficiencies, minimize duplication, but however that's formatted, that the rural constituents' voices will be understood and appreciated, and we'd have the opportunity to self-identify. I think the key policy choice is that we don't have to amalgamate based on geographic boundaries that are set by other authorities. Just reading through the history of Norfolk County, it was the amalgamation of many townships, and my guess is they were arbitrary, and they became Norfolk County. So I think that we could perhaps argue that quite boldly.
Thank you. I was just wondering if there's been any ongoing discussions with our local MPP regarding the looking at some autonomy for Haldimand and Norfolk in regards to the restructuring of health units.
Thank you. Through the chair to Board Member Huffman, we have not had any conversations with our MPP, but now that you've mentioned that, we will definitely, after this session, as we articulate the key messages from the board and circulate, we can definitely have those conversations with our provincial officials.
I think we'd be interested in hearing his response to it too.
We would be happy to invite you to the conversation. So if I may, Madam Chair, though that kind of concludes our 4 areas from a staffing perspective, but it's not limited to those 4. We did want to identify, the top 3 to 5 key messages that this board would like us to take forward with a couple of elected officials as we move forward with consultation. But we wanted to open it up for one final opportunity. Is there any other areas of priority or any other thoughts around the table that you would like us to take forward from your perspective?
I think you covered it all pretty well.
So if I may summarize, and we'll take all of the feedback today and we'll write them up and we'll find them and circulate them. What I think we heard is we want to fight aggressively for our local voice, and our ability to set our own priorities locally, recognizing some of our very unique populations that we serve. We want to, in the regionalization area, consider putting forward potentially the option of a 2-tiered option. And from a governance perspective, to ensure that we have fair representation regardless of what type of governance structure that we have, and not losing sight of our local voice and autonomy. We talked about access to primary care and that local need. And then finally, from a boundaries perspective, we want to bring forward self-identification of potential merges, if any should occur. So at a very high level, I think that's what I heard. If there's anything further, I'll open it up one last time before we conclude.
Thank you. I think something else we should really push for is more time throughout the whole process, that once boundaries are set, it's not here are your boundaries, here's your governance structure, this is what the board or agency that's going to supersede is going to look like. I think that we should really fight for a one step at a time, so it gives the municipalities a chance to pivot if we need to, if all of a sudden we are with Hamilton. Now we know, so we can get another strategy going. So I think that'd be a good thing to shoot for as well.
Thank you, Madam Chair, through to Board Member Taylor. We can definitely add that if that's the board's wishes.
Can you articulate that once more for me?
So make sure the province knows that once they set the boundaries, we want to have time to then discuss it further of, okay, we know that this is going to be the region. We might want to attempt to have a different governance structure of this region now that we know what it consists of. Instead of just dumping every decision out at once, there's a little bit more time to allow us to adjust if we need to take a different approach.
So thank you. So just to conclude this part of the Board of Health meeting, so some of the next steps, elected officials and staff, as I've mentioned earlier today, will present your key messages and submit a formal submission to the Ministry of Health, which is due at the end of February. So, and again, I'll just remind everyone, we will circulate it, and if there are any further commentary, and then we'll provide it in an information package at our future Board of Health meeting so everybody's aware of what was actually submitted. And with that, I will conclude our presentation and like to thank the board for your insightful thoughts and your dialogue, and we will definitely take your perspective forward.
Thanks to you both for your continued advocacy on this. So I guess we're moving along in the agenda over to the staff reports. I think, Shanker, that's your update that's up next.
So, Madam Chair, with your permission, I'll deviate a bit from the formal report because of the challenges that we've had with the coronavirus. So I think many of us and many people have heard the media reports, the newspaper articles, the items in social media related to the novel coronavirus in China, which is predominantly in China. And the one core key message I'd like to share is that based on the information we have today, and we've been monitoring this closely, the risk of people in the counties of Haldimand and the county of Norfolk getting ill from the novel coronavirus are low. And if I could share in context, the Public Health Service, our core mission is to evaluate risk. So there were about 20 people who died in motor vehicle collisions in Haldimand and Norfolk County last year. There are about 110,000 people. The background risk of dying in a car crash is about 1 in 5,000. So we always have to evaluate risk. At this point, the risk of coronavirus affecting individuals in the counties are low. But if I could, after leaving that core message, I want to share with a little bit about the broader context. So what is the coronavirus? What is the novel coronavirus? Well, coronaviruses are a group of viruses that can cause a variety of clinical challenges. They can cause bronchitis, they can cause pneumonia, they can cause, it's part of the group of viruses that can be attributed to the common cold. It can also be the virus family that's associated with SARS. And right now, this is a significant worldwide problem. There are approximately 21,000 cases reported this morning and 427 deaths. There are cases in Asia and Europe and in northern Canada and the United States. The symptoms of the novel norovirus are similar to other respiratory illness: cough, fever, shortness of breath. And the strategy, what is our strategy currently in Haldimand and Norfolk counties, and what's our strategy throughout the province and throughout the country? It's really focused on containment. So the containment as a strategy, as a public health strategy, is to identify every person who's been affected by the illness, provide them with treatment, and build strategies or develop strategies to prevent them from communicating the illness to others, and also to identify the contacts, people that might have been affected, and to monitor them closely. And that is what is happening currently. There have been 4 cases of recognized illness in Canada, and it seems like all those cases are being well managed. If I could provide some broader context as well. The nature of providing health services and public health services is to manage things just like the novel coronavirus. In my lifetime, there's been SARS, there's been H1N1, there's the Middle Eastern respiratory virus, and that that doesn't mean these are not challenging items, but ultimately they are managed, and we try to minimize the impact to both individual patients and to the public health. So I would say that in closing, as it relates to the novel coronavirus, that the risk is low. From everything we know today, the risk is low. And the second is that we will continue to follow the situation and update the Board of Health and the community. And if Board of Health members have any questions, just to call me, and we're happy to have that dialogue. If I could shift to the formal part of my report, I think I still have my 3 minutes left, I wanted to talk a little bit about community. When we think of community, the classical definition of community is a group of people who live in the same place. But really, that's not what community is all about. In a more contemporary view of community is a group of people that have a sense of common purpose, people who share an affection for each other. They have common actions and experiences and perspectives. In my mind, that's really what a community is. And the reason I bring up the construct of community is this relates to immunization and vaccination. When somebody gets immunized for a disease, when you take your child to the doctor for an immunization, the most common reason why is you want to prevent your own kid from getting sick. That's what I would do. But really, many times when you immunize a child, you also protect a whole group of people or a small group of people who cannot get immunized. And that is part of being a member of a community. There are some people we cannot immunize in medicine because they have a serious medical problem that precludes them from immunization. Or there are people that have multiple medical problems that are debilitated, and an illness that would cause a minor inconvenience could be a real serious problem to them. So when I think of people who get vaccinations for them and their children, they're helping their family, but they're also advancing an important community interest. So to that extent, today my colleagues and I are going to talk about vaccination, immunization, and programs to advance immunization in our community. I think it's a really important part of our public health practice, and I hope it's of interest to all of you. Thank you.
So, Madam Chair and board members, I'd like to have Ms. Titmus present the report.
Board Member Van Passen.
Thank you, Madam Chair. Just as a point of order, can I ask the clerk, are we going to get in trouble if we don't open the Public Hearings Committee by 3:15, then recess it and continue on with this meeting?
We made a point at the beginning of stating we were going to go till 3:30.
Because we don't get more LPAT hearings, we had enough of those.
Are you guys okay if we finish? Thanks.
Good afternoon. My name is Sarah Titmus, and this is my colleague Jamie Hagan, and we will be presenting report number HSS 20-01, Immunization of School Pupils Act Process, and ask that the board accept this report as information. This afternoon, we will provide you with a brief overview of the Health Unit's efforts to implement ISPA through a rigorous suspension process. This is just one of the goals that the Vaccine Preventable Disease team work on each year. So why are immunizations important? Simply put, immunizations save lives by preventing serious illness. Immunizations are seen as the cornerstone of public health, and it is thanks to vaccines that infectious diseases that were the leading cause of death 100 years ago are now the cause of less than 5% of all deaths in Canada. Now that we know that, what is the Immunization of School Pupils Act? Well, ISPA was put in place to increase the protection of children against designated vaccine-preventable diseases, and you'll find the list of those diseases located in Appendix A at the back of the report. Outbreaks of these diseases are adverse to those who become ill, are costly to the healthcare system, and put vulnerable populations at risk, those who can't be immunized or those with weakened immune systems. The Act requires that students attending primary and secondary schools be immunized against the designated preventable disease list or have a valid exemption on file. To meet this regulatory obligation, the Board of Health is required to collect, maintain, and assess records of immunizations of students attending schools within the health unit's jurisdiction. As authorized by the statute, the medical officer of health has the authority to temporarily suspend students from school if parents and/or students have not complied with this legislation. So what is the health unit's role in implementing ISPA? As our focus is on protecting students against disease, we commenced our annual review of records for all students aged 7 and 17 years of age, so that's birth cohorts 2012 and 2003, in November of 2019. A total of 1,585 notifications were mailed in December 2019 to parents and/or students who had incomplete records on file. Several options were provided to resolve immunizations issues, which included students who have received their immunizations but have not yet reported them to the health unit can provide that information to the health unit by a fax, telephone, online, or in person. Students requiring immunizations can make an appointment with their family physician or nurse practitioner, attend one of our health unit-sponsored school vaccination clinics, or make an appointment to visit the health unit offices. Students with medical exemptions or conscientious or religious exemptions are also accommodated by contacting the health unit to complete the required steps and documentation. The health unit also works with family physicians to increase vaccine reporting and immunization uptake, as well as providing vaccination clinics in both Haldimand and Norfolk counties. Following this process, students who continue to have incomplete immunization records will be suspended from attendance at school for 20 days, commencing March 25, 2020, by order of the Medical Officer of Health as per ISPA. So as we are still working through this year's ISPA implementation process, we thought it would be helpful to provide you with an update of the completed 2018-2019 school year process. Last year, our process included 44 of the 47 elementary schools and all 9 of the high schools in Haldimand Norfolk's jurisdiction. For 7-year-olds, so that would have been birth cohort 2011, 1,226 individual records were assessed, with a 91 to 95% compliance rate for ISPA reportable diseases. For 17-year-olds, so that would have been birth cohort 2001, 1,075 individual records were assessed, with an 89 to 92% compliance rate for ISPA reportable diseases. Across the 2 age groups, the percentage of children who were covered by a religious and/or philosophical exemption was estimated at approximately 2 to 4% across the diseases of interest. During the same period, there were no children covered by a medical exemption in these cohorts. In 2008, the VPD team also expanded the ISPA assessment process by introducing a catch-up strategy that involved assessing the immunization records of children outside of the suspension cohorts. This catch-up strategy includes record assessment, catch-up letters, immunization clinics, and immunization record updates, with a projected long-term goal of decreasing the number of active suspensions annually. In the first year of this process, summer of 2018, records for birth cohorts 2003 and 2012 were assessed. This has seen our pre-suspension notifications for the 2019-2020 school year decrease by approximately 11.2% from the previous school year. In the second year of this strategy, which was the summer of 2019, the VPD team focused on the immunization records of birth cohorts for 2005 and 2013. These students will be assessed for suspensions in the 2020-2021 school year, and the team is aiming to see a similar decrease in the number of pre-suspension notifications mailed out to parents and/or students. In conclusion, ongoing immunization programs that ensure high vaccine coverage rates for ISPA-mandated vaccines are needed to maintain low levels of vaccine-preventable diseases. When vaccine programs are successful and rates of vaccine-preventable diseases are low, there is potential for people to question the need to continue such programs. This may lead to lower vaccine coverage rates for ISPA-mandated vaccines and inevitably a resurgence of vaccine-preventable diseases in our community. Thank you, and I will open it up to questions, and my colleague Jamie will take those.
Thanks very much. Thanks, Jamie. Board Member Huffman.
Thank you, Chair. I was recently, as of last night, following some Facebook posts regarding letters being sent out and kind of a lot of community input in terms of it. There appears to be some misunderstanding within the community as to how the information gets from the family doctor to your offices. There was also people discussing the little yellow immunization cards that they have and different things. So if you could very clearly go over what the process is once a family or a parent, a guardian takes an individual in to receive their immunization, what are then the steps that happen so that we know that they're not going to get letters about suspension?
Through the chair to Board Member Huffman. So unfortunately at this point, if you go to your family doctor, there's not an automatic system within their medical record that automatically kicks the immunization that they've provided to our system. They don't, I mean, eventually, hopefully that will be something that's we're able to do, but right now it doesn't work that way. So if a child goes into the family doctor's office and receives an immunization, it is ultimately the parent's responsibility to report those immunizations to public health. We do have some family doctors who report independently. They'll send in a monthly antigen report, but they are not legislated to do so. That's not something that they are bound to do. They do it in good faith to communicate back and forth with public health. So we do get a certain number of doctors who report monthly. We encourage that, but not everybody across the board does. It can be similarly difficult when they're coming from other areas or other provinces. So it does ultimately fall to the parents to report the information for their children. I would imagine also that some of the confusion that's happening online are from people who did not necessarily receive a letter themselves, because we did try to clearly outline the steps that they can go to and the methods they can use to report those immunizations to us.
Yeah, no, quite a few of them were people who received letters, and it was the confusion of not knowing that they just assumed that once they went to their doctor, they filled out, whether it themselves or the doctor filled out the little immunization card. I don't know how many of those individuals, if they're still used or not. I know they were with my kids, but my kids range in ages. So there was just that confusion, and quite a few. Thank goodness there was not a lot of any anti-vax stuff. It was all about everyone understanding the importance. It was that kind of that drop in the system as to, well, I went to the doctor, I had my child immunized, how come they don't have the information? So I just wanted it to kind of be clear, very clear for everyone what that protocol is. So. And I would assume that when children are receiving their immunizations at a school clinic, that goes directly to the health unit. You have those immunizations on file.
That's correct.
Okay.
Yeah, we put those ourselves into the system, so they do sit there, and same with anybody who comes into one of our community clinics. Those immunizations are automatically recorded. But you're right, some doctors still use those yellow cards and fill those out when the parents bring them in with each visit, and other doctors don't give out the yellow cards, and they just keep it on a medical record within their office.
Any further questions? No? Thanks very much for coming. Thanks. If I could have a motion to receive the report as information. Moved by Councillor Martin, seconded by Councillor Taylor. All those in favor? And that's been carried. And my apologies earlier, I should have had a motion as well to move Dr. Shankar Nasathari's health update as information. Moved by Councillor Martin, seconded by Councillor Rabbits. All those in favor? And that's carried. Now, did you want the closed session portion, is that just 5 minutes? Okay. So if I can have a motion, been moved by Councillor Rabbits, actually seconded by Councillor Geisens, that the Board of Health move into closed session at 3:24 p.m. to discuss the following matters: Health and Social Services verbal update regarding an alternative service structure pursuant to Sections 239, 2B, C, D, and K of the Municipal Act 2001, as the subject matter pertains to personal matters about identifiable individuals, including employees of local municipality or board, a proposed or pending acquisition or disposition of land by the municipality or local board, labor relations or employee negotiations, or a position plan, criteria, or instruction to be applied to negotiations carried on or to be carried on by or on behalf of the municipality or local board. All those in favor? And that's carried. So they just said 5 minutes, so we'll try to be as quickly as possible.
Now the microphone, and you see from the side it's red. Microphone's on.
Could I have a motion just to reconvene the Board of Health in open session? Counselor, moved by Counselor Van Passen, seconded by Counselor Rabbits. All those in favor? And that's carried. And I need a mover and a seconder that the Board of Health directs staff to explore options regarding alternative service structures. Moved by Counselor Taylor, seconded by Counselor Van Passen. All those in favor? And that's carried. And finally, motion moved by Counselor Rabbit, seconded by Counselor Martin, that bylaw 2020-02BH being a bylaw to confirm the proceedings of the Board of Health for the Haldimand Norfolk Health Unit at this Board of Health meeting held on the 4th day of February 2020 be passed, signed by the Chair and County Clerk, and affixed with the corporate seal. All those in favor? That's carried. Okay, and that's moved by Counselor Martin, seconded by Counselor Geisens, that the Board of Health be adjourned at 3:38 p.m. Thanks to everybody's patience that's here. All those in favor? And that's carried. All right, are we ready to carry on? Moving over now to council. Public hearings, rather, I should say. I'd now like to call to order this meeting of the Public Hearings Committee. Are there any declarations of pecuniary interest? I see I'm still missing a couple councillors. Remind me when they return. Seeing none, I now officially open the public hearings, or meetings rather, held under the Municipal Act and the Planning Act. Please be advised that to preserve your right to appeal to the local planning appeals tribunal, you are required to make comments or provide written submissions prior to the passage of a bylaw. The first is staff report DCS 20-02 in regards to Norfolk County has initiated an official plan amendment and zoning bylaw amendment to update the drinking water source protection policies and associated mapping. The Long Point Region Source Protection Plan was updated and the changes came into effect on March 25th, 2019. The proposed amendments will implement changes to the official plan and zoning bylaw. And Matt, is that you that's presenting this? Thanks.
May I start?
Yeah, go ahead.
Matt? Yeah. I just wanted to remind, for the purposes of today's public hearings, we've taken a new approach to these reports, which is that we're doing for information only reports today with no staff recommendation, with the idea that in the event there was any significant public concern, that could be more fully considered before it actually went to council. And in the meantime, we have two reports which were authored by Alicia Cull, who's now on a leave, and Matt is going to be the person speaking to them. Thank you.
Any declarations of pecuniary interest on any of these reports? No. Okay.
Okay, thank you very much. So the affected municipalities were given 5 years within which to complete an official plan amendment incorporating these new policies. Planning staff chose to complete them quicker to ensure that the official plan remains current. The proposed amendment will implement the new policies. This report is being presented as part of a statutory public meeting required by the Planning Act. A subsequent report will be brought forward containing a recommendation at a future time. So the report today is just to be received as information. If there's any questions, let me know.
Any questions? Councillor Rabbits.
Thank you, and through you. Matt, my question for you, we got a couple different maps here. One's page 11 of our report. Confirm that. Yep, page 11. And then we've got a similar map on page 15, and I see that they look fairly different, and I was hoping for just sort of a layman's interpretation of why those maps vary. I see 2019 is on the one on page 11. It's Schedule D4. Schedule D4, it appears again on page 15. I don't see a date on it, and they look a little different. They're going to be in the appendix A.
Just give me one moment while I get to the same pages.
That's the update, the later ones? Oh, that would make sense.
Okay, to Councillor Rabbits, these two maps basically show what was and what is now. It's kind of hard to distinguish the two, but the map that is being it's being changed to looks a lot more complicated. Rather than just having the sort of the it's really hard to describe, but rather than just having the swish lines, they've done some remodeling, and as a result of the remodeling, the areas, the vulnerability areas have expanded or changed in some capacity. So the area that seems like that looks larger, that is based on the remodeling. So that's what we're going to be going with.
Councillor Van Passen.
Yes, thank you, Madam Mayor. I do have one question. We just spent like $1 million putting a new well in off Cloet Road. How come there's no map for that one?
Through the chair to Councillor Van Passen, when you get into well drilling and well exploration of this magnitude, basically you first need to determine if there's sufficient quantity of water available. So the first thing that they've done is they've drilled those test wells out off of Cloet Road and come back with satisfactory results that there's actual yield there. The next part of that would be, should we choose to develop that, is they would end up be doing some of the same modeling to actually get the extents of where the aquifer draws from and that direction of flow, and then any of the policies that would pertain to that for the wellhead protection area policies in the source protection plan would then be applied at that time.
I just assumed that you'd sort of have some sense of how big an area the flow is available before you sunk the $1 million well in there, right?
Through the chair to Councillor Van Passen, I can't say based on the preliminary hydrogeological studies they've done, they knew that there was sufficient water out there. Now it's a matter of when they actually run the pumps, how does that water basically travel to the point where it's being extracted? And that's typically what you'll see here. Like we know in the northwest of Simcoe, the water is coming from that northwest area and coming southeast towards those wells. it's not being drawn up from the south due to the geology underneath. They cannot determine that until they're actually doing those full rate pumping tests at the time, despite the fact they know there is a sufficient quantity down underground.
Thank you, Madam Mayor. And Matt, if I could ask, could you list off some of the restrictions, like the map of the Simcoe wellhead, the extension of the least vulnerable section is extended quite a bit in the new mapping. Could you list a few of the extra restrictions that apply to that zone?
So it gets a little complicated in terms of use, but generally it would restrict really high intensity industrial or really high intensity agricultural uses. What we're looking to try to do is prevent water contamination. So more, the closer you get to the source, the higher the management practices become, and the less you are able to do in terms of an intensive use. So we're always trying to minimize runoff and minimize absorption rates into the ground. So manure storage becomes a problem. How to store manure, how to contain it, and likewise things like salt or any other like heavy metals, looking to contain those things or at least reduce them in certain areas. And this map just reflects those, an updated area so that we try to minimize those uses as well as we can. And just maybe to paint a little bit more of a picture with how this works from a planning perspective. So when we get applications in for a new use in an area like this, it'll flow through our pre-submission consultation process first. When it goes through that process, that's when this mapping gets used. We'll pick it up through our review of the land use piece. And if they're proposing a new use that may introduce conflict or may introduce some sort of a contamination, we'll pass it through environmental services. Environmental services will, they have a contractor, a consultant that will provide comments to us, and then we provide those comments to the applicant. And if it's the type of use that wouldn't be conducive to this area, that's generally where it stops. They wouldn't go any further because they may not have known about the source protection zone at the time. If they want to move forward, then at that point they start to put together a management plan for how they're going to contain those contaminants and that sort of thing. So that's from a land use perspective, that's how this would go through that process.
So I'll just assume that most of the increased area is zoned as agricultural land, so just a basic question on that. So if you want to have a couple of pet horses out back, that's not going to be affected by this, but if I was to apply for a new hog barn with 5,000 hogs in it, that would be something that probably wouldn't be allowed in that new wellhead protection zone?
Yeah, through the chair, it would be a site-by-site and application-by-application process, and it would be looked at in its own merits. And they would have to come up with a management plan for whatever it is. And other than that, Jason, if you want to add anything.
Through the chair to council, just in general, like the source protection planning process identified 21 significant threats or potential significant threats to municipal drinking water supplies. 19 of those are quality related, and some of those could be as a result of industrial, commercial, or agricultural operations. Generally speaking, when all these rules were originally drafted and implemented for the Long Point region, there was always a very heavy consideration given to agricultural practices. Most of the area that you see that falls into a wellhead protection area C or D, there's not a lot of agricultural operations that would be impacted by policies. We have to show them on the mapping because currently there's not restrictive policy associated with it, but that's not to say that the Clean Water Act may not be revised in the future by the provincial government. Therefore, generally what we've seen out of all of this is there's been a minimal number of actual properties within a wellhead protection area A or B, which are the two closest to our wells, that would actually have to do anything. Some of the policy speaks to, an ag operation that may require having a nutrient management plan, which a lot of those larger operations have to have anyways. And so we've kind of, rather than adding additional restrictions, the thought process in our area was, if they're already doing something to satisfy one of the provincial agencies, we may just request to see it and approve it and say, okay, yeah, you have it, and you're good to go. As Matt alluded to, it does come down to a case-by-case basis. We have a risk management officer and a risk management inspector that are responsible for implementing any of the inspections and oversight of this policy. Basically, when we know an activity is occurring in one of these areas, they're the ones that do the initial screening, compare it to the giant stack of policy, and would then do that landowner engagement and follow-up. We have had no instances where we've had a prohibition of an existing activity. That was another thing when all the policies were developed, that we did not want to go down the road of forcing people out from doing what they've always been doing. A worst case scenario, there was some areas where they needed to develop a risk management plan, which would basically just say, if you're storing chemicals here, how are you going to react should there be an issue, in order to minimize any threats to the drinking water supply. So it was a long drawn out development of all these policies, and there was always that bit in everyone's mind that we weren't trying to push anybody out, we weren't trying to be overly restrictive, but we also had to kind of balance that with what the needs for protecting our groundwater supplies were. I don't know if that helps provide any other context. That
I've been involved in this right from day one, so I actually do know a little bit, but I want to make sure that everybody's aware that they're changing the lines, certain things you can and can't do. It's a matter of risk. It might be okay to keep your 100-gallon tank of diesel fuel on the farm, but you can't keep a 10,000-gallon tank. There's, the bigger it is, the more of a risk. The larger the livestock operation, the higher the risk. So yes, there's a certain limit that would be allowed, and beyond that limit, it's not going to be allowed. So anytime that we arbitrarily change lines on a map, that all of a sudden there's going to be 50 farmers that are now in a zone that they weren't in before, I just want to make them aware that we've just added a new layer, or somebody has added a new layer of mapping again that, Norfolk County didn't draw it up. It's another layer, and we're just including it to make people aware that there are different conditions in these areas that you can and can't do things. So.
Councillor Van Passen, any further questions from the committee? Does any member of the public wish to speak to the Norfolk County Official Plan amendment? Okay, in that case, if I could have a motion to receive the report as information, moved by Councillor Huffman, seconded by Councillor Taylor. All those in favor? And that's carried. And on to the second staff report, DCS 20-20. It's in regards to an application that's been received to amend the official plan and zoning bylaw to permit residential apartments on the main floor of an existing building without commercial space. Great Lakes Land and Farms Corp. and Agent Civic Planning Solutions have put forth the application affecting the lands described as 80 Alice Street. And Paula, is this your, Matt, you're presenting?
Hey, thank you. This is an application proposing to use the entirety of the existing building for 21 bedroom residential apartment units. The official plan and zoning bylaw do not permit residential development along the first story frontage of a building in the downtown designation or central business district zone. The applicant is proceeding with 16 residential units, and the building requires an official plan amendment and zoning bylaw amendment to permit 4 additional units along the Alice Street and St. James Street south frontages. And as I said in the last report, this report is being presented as part of a statutory public meeting required by the Act, and we will be bringing a subsequent report forward with a recommendation. So this is an opportunity just to learn more about the application and receive information about it. If there's any questions, please let me know.
Any questions of the committee? Councilor Shelley.
Thank you, Madam Mayor. This question is for staff, and I realize that the author of the report is not here. Matt, so I'm going to ask you, and should you not be able to answer, I'll go to Paula. But this building was built in the 19th century, and I believe that some time ago we made the suggestion that any items that were of historical or of cultural significance in Norfolk County, that the Norfolk Heritage Committee would be circulated on these reports, and I see that they are absent from this report, so I don't know if that's an oversight or if that's something we need to revisit. Thank you.
Through the chair, I can't say for certain whether or not they were circulated. I wasn't part of it at that time. What I can suggest is that rather than bringing this report back in 2 weeks, we take a little bit longer and make sure that they have an opportunity to review it.
Well, Matt, I'm not sure that that's necessary in this case. I just want to ensure that I'm just wondering if this is just simply an oversight, or if this is just something that we need to kind of revisit to ensure that the Heritage Committee is circulated on these types of items. So I'm open to any suggestions in that regard. I don't want to unnecessarily delay this project if that's the case, but I would like to ensure that for this matter and for future matters that is the practice that I believe we did establish.
Councillor Hoffman.
Thank you, Mayor Chop. Through you to Matt. My question, in following up with Councillor Michelli, is that in terms of the heritage aspect of it, would that not be something that if it was already deemed a heritage structure, it would have to go through the heritage and culture?
I believe, council's through the chair, I believe the previous direction was if it doesn't necessarily have to be designated, but if we thought there was some sort of cultural or heritage history with the building, that it should then be circulated to that committee. I'm not sure if it was. I assume it was, and I will double check to see if it was, and perhaps the committee just didn't have a chance to comment, or I'm not sure exactly what happened there, but yeah.
Okay, thank you. I just want to also, in regards to following up with Councillor Michelli, I'd like to make sure that we are able to maybe confirm this, but without holding up the project of any timelines that we're looking at.
The Heritage Committee also could have seen it on the agenda, I'm assuming, if they were concerned. Did they express concerns?
Not to my knowledge, Madam Mayor, but again, my point is, I know Matt keeps asking if maybe they had been circulated, but in the report, everybody's circulated. I'm assuming that if they're not included in the report, they were not circulated. And again, it's just a matter, and as Councillor Huffman is mentioning, I'm not suggesting that this is a designated heritage property. I'm just trying to remind council and staff that we had determined that any items of historical or cultural significance that the Heritage Committee would be circulated, that is just informed of these things. And yes, they could have seen it on the agenda, but I don't, that's not really the point I'm making. I just, for a matter of procedure, they should be circulated.
So, excuse me, I think it is fair to say that if they were not referenced by Alicia as having been reviewed and commented, it probably wasn't. I don't know why. In other words, perhaps somehow through the application process, it wasn't ever made clear to our staff that this had some heritage features that might be of relevance through a planning justification report or otherwise. So it could have just been a process oversight. So I'll be sure to speak to Matt and review the file and check to see if somehow we missed it.
Thank you.
So they would have 2 weeks, would they not, until the council meeting to be able to submit something if they wanted?
I think, I mean, they may or may not wish to do that, but we'll check. And yes, we would bring it back in 2 weeks.
Again.
Councillor Van Bassen?
Thank you, Madam Mayor. I don't know if Jason or Paula can answer this, but a while ago, I do believe we approved an encroachment agreement on this property for the front door and asked to look at a bump out around where they were putting an accessibility ramp. Did that all get completed already?
I do not know the answer to that question, but our clerk may.
Through you, Madam Chair. The encroachment agreement, we reached out to the owner of the property and indicated council's desire because council wanted to offer up the parking spot for that ramp. And we didn't get a response until about a few weeks ago. Then we started having a response, and the initial indication is that they don't want that now. We're just trying to nail down whether or not they actually want that or if they just want an overhanging encroachment now. But either way, we're going to be able to facilitate something for them.
Yeah. All right. I just hope it...
Councillor Martin, I saw your hand.
Thank you, Mayor Chop. A question through you to Matt. I'm assuming we would hear more about this later, but I read because of it's located within the central business district, there's no requirement for parking. Any comments on that?
Through the chair, you're correct.
Councillor Huffman? Okay, does the agent wish to speak?
Thank you, Madam Mayor. I guess one general comment before I begin. Having sat back here a number of times in the last month or so, the acoustics and the being able to hear, especially people, older people, gets very difficult. And I think some of it is people not speaking into the microphone, or it could be just the general level of the volume. Because I was starting to think, am I need a hearing aid? And then I asked the fellow beside me, he said, I can't hear either. And I got a hearing aid, so I knew it wasn't that. So maybe it's a matter of, my mother always said, stand straight, speak slowly and speak clearly. So I guess that's part of it as well. Well, yeah, okay. To start on my presentation, the application before you is a combined official plan amendment, zoning bylaw amendment, but it's actually a very scoped amendment. It deals with the ability to use the front portion of a property that's zoned commercial for residential purposes. Under your bylaw, you are permitted to have accessory residential located in the rear portion on the main floor and any floors above. This amendment will permit an area set aside for commercial use to be used to create 4 one-bedroom apartment units. Prior to submitting this application, my client, an experienced local real estate broker, tried to find a suitable commercial tenant for this space, thus avoiding the need for this application. He wasn't successful in finding such a tenant, and keeping in mind it would have to be an appropriate commercial use, i.e. A restaurant or a tavern wouldn't necessarily be very compatible with residential apartments above, especially in an older building. The units will front onto Alice Street. The remaining building will contain 6 one-bedroom apartments on the ground level, and 11 one-bedroom units on the second floor. The subject lands are located at 8 Alice Street, west of the main core. The existing 19th century two-story building has been used for industrial purposes in its early years and more lately used as a flea market. The upper floors were illegally converted into apartments without building permits. The footprint of the building is approximately 8,600 square feet, 800 square meters, and is in a state of disrepair. I've handed out copies of the plans with the floor plans and the front elevations of the property, which I did give to the clerk, and he seems to be missing. They should be on his desk. Okay. And I guess to answer Councillor Michelle's concern, you will see that the elevations and the facade of the building is being kept intact, and for a non-heritage designated building, it does maintain the historical attributes of the building. And as was already mentioned, Council should be familiar with the new entrance facade that was approved through an encroachment agreement with Council. This is a major investment near the core of Waterford. The proponent is very experienced and has a solid track record relating to development. A total of 21 new one-bedroom apartment units will be created. These will be rental units. The building will be handicapped accessible with ramps and elevators. The target tenants are single or couples, likely retirees. Under the current zoning bylaw, there are no on-site parking requirements. There's upwards of 60 parking spots on the north side of Alice Street, opposite the building, another 10 or 11 parallel parking spaces in front of the building between St. James and Wellington. And my client has a right of easement, and I think I said in my report that it was a lease agreement, but it's actually a right of easement for parking on an adjacent lot owned by the neighboring property owner, where there's approximately another 50 or so parking spaces. And our lawyer will speak to any questions that you may have regarding that agreement, which is registered on title. And our neighbor will speak to her concerns, I'm gathering, regarding this. Nevertheless, parking is not a requirement, and we can get a building permit today for 16 apartment units and commercial uses in the front portion of the main floor. Now, there are two vacant buildings at the intersection of, I guess it would be Main Street South and Ellis. That is the former bank building and the mattress shop. The commercial area, which is what I would deem the core because it is almost entirely all commercial uses, pretty well ends at the retirement home. Now, there are a few commercial businesses located going further west from there, kind of interdispersed with residential uses. The further west you go on Alice, the more a mixture of commercial, residential, and then primarily residential. Trends in more recent years have been that the core areas in towns like Waterford to shrink as retail uses close or are converted to more service-related uses, such as coffee shops, hair and nail salons, that type of thing. Retail stores are now located in larger urban communities like Simcoe or at regional scale shopping areas like Brantford or Hamilton. Housing issues such as the availability of affordable rental housing has been identified as a concern in Norfolk County, and in particular, rental one-bedroom units. The proposed units will be market rent, but are expected to be considered to be affordable. The units will, and most likely, attract single persons or couples. Now, some people do not want affordable housing located near them. However, with home prices at all-time highs, there's a greater need for rental housing. I expect some seniors may sell their homes and choose to rent, provided there is suitable rental housing available. Now, what is the impact of this application on the core function of the Waterford Central Business District? I feel it will be minimal in that the property is well removed from the commercial area at the intersection of Alice and Main Street South. It will actually create 21 new residential units within walking distance of the commercial area, which will support existing businesses. There is no identifiable negative impact on the function of the commercial core area in Waterford, at least from my perspective, and I also see this as a major investment in Waterford. Now, we were asked to defer this application in order to meet with the neighboring property owner. This application was deferred from the December meeting. Myself and our lawyer met with the neighbor on January 23rd. However, she was not willing to discuss our concerns without our client present, and he was out of the country. We felt that it's important to proceed with the public meeting today to hear all concerns, if there are any, from all neighbors. And once we know those concerns, we can then respond to them. In summary, this is a great project. It will provide 21 additional rental units in the Waterford housing supply. It must be remembered that the relief being requested is for the conversion of the commercial floor space that is located in the front of the building to create 4 one-bedroom apartment units. And on-site parking is not required under the bylaw and should not be an issue. I'm satisfied that the proposed planning applications are consistent with the policies of the provincial policy statement and the intent of the Norfolk County official plan, and do represent good planning, and I urge Council to support this application. Thank you.
First question from Councillor Huffman, then Councillor Taylor.
Thank you, Mayor Chop. Through you to Mr. Rowe. A couple points. One, your line in terms of what is the impact of this application on the core function of the Waterford Core Business District is that you feel it will be minimal. I disagree. I think it will be an amazing impact on the core business district. So I'm not sure.
Okay, in terms of a negative impact.
Okay.
I see it as positive in that we'll have 21 more apartment units with people living within walking distance of
right, who are going to
core.
go to the antique
Yeah.
stores and the coffee shops and the upholstery and the, okay, all right. Yeah. I was a little confused by that. But I do want to say that I want to make sure that when we're going forward, this has been kind of something that this council has been as a big proponent on in terms of affordable housing. I do want to make sure that we're not confusing affordable with available. When you're using the term affordable housing, could you please expand on that, why you're using that term?
I'm using it in the broad market sense, not affordable under provincial legislation.
Okay, well, that would be worth a clarification there, because I know that you did mention that you said a neighbor didn't, not, that just irks me, but anyhow, that a neighbor didn't want to have affordable housing in the neighborhood.
Yeah, and I've had this in several or more than several applications that I've dealt with in the last few years, where we have neighbors who say, well, we don't want low-income people living near us because, on and on and on, the regular thing they say. But the reality is, in Norfolk County, is that we do need rental accommodation that people with lower incomes can afford, because they've got to live somewhere. And I get really bothered by people with the attitude saying, well, they can go someplace else, I don't want them near me, where that is horrible, in my opinion, a horrible attitude to take.
Okay, well, I can tell you that that won't fly with me for sure. But I do want to say, in terms of the points, is that I think it's a very cohesive utilization of the residential and commercial space. It will add to the downtown vibrancy. It provides housing options. And I just want to clarify as well that no matter what, if we take that commercial space out of the equation, there's no issue with 16 units going in, correct?
No, absolutely not.
Okay, so this is strictly looking at 4 units being, actually, it's 21, but you're saying
well,
16,
the total
so
of
it's
21.
5. Right.
You can have 16, well, actually, it'd be 20, I guess. No,
20.
11 upstairs,
Okay.
6 downstairs. Okay.
All right, okay.
My math here,
I was using my math skills, which aren't the greatest at any point. So again, just a clarification is that 16 units can definitely be put into this space.
Absolutely.
It's just looking at that, because there wasn't someone who was willing to take up that commercial space at this point in time.
And an appropriate use
Right.
for the space.
The developer has decided to utilize that commercial space and add more units.
As opposed to it sitting
Okay.
there empty.
All right,
And,
perfect. Thank you.
You're welcome.
Taylor, Councilor Martin.
Thank you, Mayor Chop. I find it odd that once again this council finds itself in a situation where a developer is in front of us saying, don't worry, we're going to gear it to retirees. Because I think we've voiced our opinion on it. I love this project. This is great. Seeing dense infill is amazing. But we need a spot where a young professional can come rent a place for a year that they can work out their contract and see everything that Norfolk has to offer. I just want to make sure that if a young professional comes and sees this apartment, like, you know what, I could rent a spot here and work, that they're not going to be turned away just because they're not a retiree.
When you're developing residential properties, those obviously geared to families will have playground equipment and recreational facilities that would encourage families. Other units don't have those, so consequently, especially with one-bedroom units, you can get young married couples, you can get single people, and then you certainly, on the other end of the demographic scale, you get widows and older married couples. So you're kind of picking them up from both ends of the spectrum.
Martin.
Thank you, Mayor Chop. This proposal sounds great from the perspective that you're putting walking bodies downtown in the community to then spend their money and they're in close proximity. And I think that actually this type of proposal would thrive, and it is what downtown Simcoe could really benefit from, to be honest. But I'm just a little uncomfortable with the idea of the parking. I understand that you're articulating that there are lots of spots around, but I would hate to see a community struggle to find parking when they would come and look to those spots across the road to go to the ponds or whatnot. I would hate to see families not be able to go down and use the park because the residents were parking across the road. Is there any type of creative solution that you could offer up to this council to stew on, or should I look over to Matt? I understand it's not a requirement, but it is something that makes me feel a little bit unsettled.
Well, I would think that it would be based on demand. We don't know at this point what the what the parking, whether there'll be a parking issue there. It depends on the people obviously residing there. If they're working people, they're away during the day when families may want to come to the pond area. I think too, if we look in terms of there is a great demand for people to picnic and whatnot. It's very scenic by that pond, that it may then be an opportunity to expand the municipal parking in that area. But presently, as the bylaw as it sets, puts no requirement for parking. So in this scenario, we have to say, well, if there's a hairdressing salon in that commercial space, how much parking will that create, demand will that create versus 4 one-bedroom units? I think the point that you made earlier, as I look at the Norfolk official plan and having been involved in the preparation of the first official plans in Halton and Norfolk going back to 1979 and 1980, if you look at the core area designations, I don't think they've changed since 1980, since the late 70s. And having spoken more recently to your staff, that's one area that they have said that they really want to look at, because the commercial trade and makeup of our communities has changed a lot since the mid-70s till today. And I think that's something that should be recognized in your new plans.
I could just follow along with Councillor Martin, though. We actually have had complaints with parking issues in downtown Waterford with our bylaw department. So I also think it's a fabulous project and I'm in support of it, but at the same time, yes, you aren't required to provide parking under the current bylaw for the units above, as well as the 4 or 6, I'm confused now, commercial units downstairs. But at the same time, you are standing here before council today asking for something from us, and that is to grant you residential apartments on the main floor as opposed to commercial units. And the reason that bylaw, maybe Matt might be able to chime in, but you're not the first developer that's come before council, actually this council even, that has asked to have that exemption. I think that became a concern as well with waterfront development in Port Dover. And the reason those are typically introduced into bylaws, that you have to have commercial space on the main floor, is because it provides vibrancy and so on in your community. It provides a place for people to sit and have a coffee along the waterfront. And arguably, that is probably the most beautiful stretch in Waterford, to be able to sit if there was a coffee shop and have a coffee across from the park. So you are asking for something from council for us to waive that commercial space, which means we are giving something up into the 20 years in the future. Don't get me wrong, it's great that we're bringing all the people to Waterford, but if councilor has concerns about parking, maybe there is something that you could offer us to perhaps ease some of those concerns, as opposed to saying, well, we don't have to do it, because we also don't have to approve this today either. Matt, do you want to maybe touch on the commercial kind of space and why planners typically ask for that?
You did a great job at it already, but I would like to just suggest there may be a solution here, and it's something perhaps the agent and their owner can speak to. There is a special provision on this site, and it's a bit dated, but it allows for parking on another property. And it makes reference to a property just southwest of here, which is currently in the MG zone. It is this area, right? I don't know if you can see on your monitors or not, but right down here. Oh, geez, I can't really just do it. But there's a property to the southwest here that looks like it's being used for parking. I don't know if it's been sold and it's now being separately used or not, but there's at least zoning.
That's the property that we do have an easement, and the intent, my client's intent would be to utilize that for parking.
Okay.
But there's some issue with the neighbor to that point, so.
Okay. So there is maybe some sort of a solution there that we could explore a little further. And just also to get back to our point about the heritage piece, I did a little digging and it was circulated to the Director of Heritage and Culture. So it has been circulated. We didn't receive comments. Just closing the loophole on that one.
Perfect, thanks very much. So if we were looking at a solution like that, before we came back to council, would you be able to write some provisional term then, that this would be approved conditional, that an easement would remain over X parking lot so that that could later be developed? Because to be honest, there's no money in Norfolk County to go and buy a municipal parking lot right now.
I hear that.
Yeah, so it, through the chair.
If you guys
Rumor
want
has
something,
it,
you need
yes.
to come forward with a few parking spaces to make this a little
Rumor
bit
has it,
easier.
yes.
Would you
Yes.
be able
So-
to provide some suggestions then for the council meeting when this
Yeah,
came forward?
and so through the chair, it would be an off-site parking agreement. We would have to put our heads to that a little bit more because we don't currently have a policy in our official plan for that right now, I don't think. I'd have to double check, but we can always get creative.
That's correct.
Yeah.
So, sorry, Councilor Michelli, then Councilor Huffman, and then Councilor Van Passen.
Thank you, Madam Mayor. Mr. Rowe, you indicated in the addendum to this report that the rents that are going to be charged will be market-based rents, but they will be reasonable. I just want to
Based on the
comment.
fact that they're one-bedroom apartments.
Yes, and I understand that, and there's a shortage of one-bedroom apartments in Norfolk County, and this will increase the supply. That's great, but just as a general comment, market-based rents in Norfolk County are not reasonable.
Also, the availability of what I would call good quality rental accommodation in Norfolk is, you're correct, it's expensive and very, very limited. I think one of the greatest potentials we have to provide more affordable rental accommodation is actually in our core areas and in the apartments that are above our stores. And what you find is that many of them are simply used by storage for the merchant, that money has not been put into those units. And there is, in terms of cost affordability, there's a much greater opportunity for much larger bang for your buck if money is spent on rehabilitating many of our underutilized residential units, especially in the core areas.
Okay, thank you, Mayor Chop. I just want to add in follow-up to Councillor Taylor, and just listening to some of the report, and again, totally in support of this project. But again, this also follows up with some of Mayor Chop's comments in regards to the Port Rowan development that we discussed a number of weeks ago. There are a lot of stereotypical comments that are being made that I would prefer that our developers stay away from.
Mm-hmm.
One of them, I think that affordability and availability is one of them. I also don't think that, and again, the marketing to retirees, why we wouldn't talk about young professionals. And when we go and we talk about young professionals, I don't think we need to discuss their marital status as well. I think
Right.
we're just looking at individuals to rent
Absolutely.
these units.
Thank you.
Okay, thank you.
Councilor Van Passen.
Yes, thank you, Madam Mayor. Back when I was in high school and we used to watch black and white TV and use pencils and pens to write, they taught me that if you increase the supply, it tends to bring the price down. So one of the reasons, and the opposite is true, so one of the reasons that rents are high is because we don't have enough spaces. So increasing them will do a good thing. But my question was, and I'm not sure if Mr. Rowe can answer this or Matt, one of them can. For 20 units in the building, if it was one block farther and it wasn't in the central business district, how many parking spaces would you require?
I will let Matt comment, but I believe apartments are 1.5 parking spaces per unit, if I'm not mistaken.
Sorry, just give me one moment. So through the chair, there is, it's 1.5 parking spaces, but then there'd also be a visitor parking requirement as well.
So if they have an easement and they're providing off-site parking for 50 spaces, that's more than they would require if it wasn't in the central business district. So they're already taking a step forward. They're trying to do the right thing. So I'm sure the mayor will squeeze them for everything we can get, but they're trying to do that, right?
Sorry, how many parking spaces are being required right now? None.
If it were not in the central business district, under normal circumstances where it's not exempt from the parking spaces, they would need 1.5 spaces per apartment. So there's 20 apartments, they need 30 spaces plus a few for visitors.
35 spaces plus some for visitors, yes, but currently they don't need any because they're a block
Yeah,
away.
so if they have an easement where they have access where they're providing 50 spaces, that is sort of the equivalent that,
Oh, I'm fine as long
Yeah.
as the easement's guaranteed. That's
Yeah.
perfect. It's ensuring that the easement's guaranteed for life was supporting that building. That's the problem. If there isn't an easement over it, then arguably and hopefully, not if, but when Waterford, reinvents itself, then, the shops are busy and so on and so forth, and people are going to the park, that maybe that parking lot might become useful for something else. It's just ensuring that the easement remains over the parking lot with that building.
Yeah, and
That's my concern.
yeah, and my appreciation is the fact that we have a developer who's already taken that step, that even though he could just argue it's not required at all, he's already making arrangements to provide some parking, so.
That wasn't what I heard. I heard that there was challenges with it.
And there may well be. I'm not sure what the legalities are. I'm not.
So that was my request, was that we see about getting the easement over that parking lot to be able to support that.
Madam Mayor, add some clarification. As of right now, both the subject property is described as being together with, and there's an instrument number that it cites. So that easement is already described as part of the subject lands. And then the neighboring property is described as being subject to the easement. So the easement is in place. My friend, Mr. Nunn, may disagree, but at first glance, subject to some sort of court action, the easement is a registered easement. The neighboring property is subject to it. Our lands benefit from it, and subject to any further, again, litigation, it is what it is right now.
But Paula, you'd be able to look into that before council to ensure that that was protected.
I'm sure I can confirm that with Mr. Kolomaya.
Okay, thanks. I wasn't looking for additional over above the parking lot. Parking lot's fine. Any further questions? Does anyone else wish to speak in favor of the application? Okay. Anyone? Okay, if anyone else wishes to speak in general or in opposition. If you could state your name, please, and address when you come to the podium.
I'm Chris Nunn. I'm a lawyer for the neighbor, who is the owner of the Waterford Antique Market, 254-4663 Ontario Inc. My client owns the property, if you look at the map, immediately to the west of the subject property. There is at that property an antique business that's thriving. Just to give you a little bit of background as far as where this application is, my client, the principal of the company, has been talking with Murray Gibbons, who is the principal of the applicant company, for the better part of 2 years to talk about how can we resolve some of these issues. And the main issue is parking. I'll get into some other details later, but by no means is there recognition that there's a legal right-of-way with the neighboring property. If there is a right-of-way, it's very restricted, and it hasn't been used for several years. There's a question of abandonment, if that legal argument needs to be raised, whether it's with merit or without merit, but it is definitely an issue. If you look at the map, the easement, so my client owns the property to the west and to the southwest, right where that side street is, in the corner is where that easement is. That easement's about 1,300 square feet. It's grassed, there are trees there. I believe there might be a fire hydrant there in the corner there. It hasn't been utilized for many years, obviously, if in fact it was ever used for the purpose of parking in that location. So if there's going to be a council decision based upon having provision for parking, I know parking isn't in the CBD zone, but it's still an issue for what we're going to be dealing with. If there's any pretense of parking in that location, it's going to be a very difficult argument to make. First, because whether we grant access, and secondly, if you look at the corner, and I've got here, I'll pass it around if you want to see it. The size of the easement, it's an L shape in the corner of my client's property. It's far away from where the subject property is. There's no right of access across our property. Anyone that's going to park there has to go all the way around, down the side street, and then up the back. And that's assuming you can park there. The cost probably to develop that piece would be prohibitive, in my opinion. But there's certainly nothing there that would support parking in that location. Sorry.
I'm just wondering if there's one of those laser pointers on our clicker there, because I would love for you to use the map on the screen to just draw attention to specifically the spaces you're talking about.
Okay.
And also, if you can use the names of the streets instead of just side streets and things like that, that would be helpful.
I'm not good with geography, even though I'm from here. For me, the street, St. James is on the right side, and on the left side is Wellington Street. So the Wellington Street is on the southwest portion of that map. So as far as background's concerned, my client, like I said, has been dealing with Mr. Gibbons for the past 2 years to attempt to sit down and talk about the issues and come up with a solution. I became involved in the fall time, and I contacted Mr. Rowe, the agent, to request a meeting in December. The council meeting was scheduled for December 10th, and we did have a meeting arranged for January 23rd to actually sit down with Mr. Gibbons. There might be a difference of opinion whether he was supposed to be at that meeting or not, but he didn't attend. I think in many respects, for council to consider this today, I think it's premature without some resolution of the access issue. Any attempt for council to impose some right of way over that property, obviously you're not in a position to do that, nor will you. It's premature because of issues.
Well, we aren't making a decision today.
Yeah.
So
No,
we're just
I
hearing
understand
concerns.
that, but just by way of background. So we made that attempt to have a proper discussion. The December meeting was deferred to allow us to do that, and unfortunately, we've never been able to successfully get the applicant sitting down with his agent and go over the issues.
I'm curious, I'm a little bit confused. So you're a store owner downtown, but you have an objection to them using that parking lot to park more cars in?
Where are you pointing to, sorry?
Well, the parking lot that we've been discussing that would hold 50 cars, you have an objection to them using that as a parking lot?
Are you referring to the parking lot, municipal parking to the north, or are you referring to the parking on our property?
There's two different areas.
Matt, if you could help me out, which part, with the easement that has?
Can I walk up there?
Sure. I got it.
And I would have had a copy of that for you. So we were
For the 50 cars.
For the 50 cars, there's no possible way there's going to be 50 cars that can fit in that location. They don't have an easement through our property. They would have to go all the way around the park and then go all the way around to access the building. The easement is very restrictive in that it says you have access to this piece. If we have to acknowledge easement, it allows the park, it doesn't seem we have to develop it. It doesn't have any right of access to the back of our building. If the drawings that the applicants were provided have, in the copy that we saw when we met in December for Sir January, have walking paths that go back to our property. They remove those from the plan that I received last night, but it still doesn't address it.
So the easement is over your property?
It's over our property.
Oh, I get it now, okay.
Right here.
Got
This
it.
is our property. It's right here. There's no means of getting from there to there without driving around.
What, walking around the street?
Madam Mayor, can I just get
Yep.
that clarified? There's a property there that you show on the map, and it doesn't touch the applicant's property.
Correct.
And the easement, is it for them to be able to use that other piece of property? And then your disagreement is that they don't touch, that they would need an easement across your client's property to get from one to the other?
My client's title is subject to the rights of the owners, occupants, employees, and customers from time to time of the applicant's property to access and park in the Part 6 on plan, which is the drawing I've given you.
So it is, there's a part there that they're using for parking. There's the building up there that they're renovating, but they have to get across your client's property to get from point A to point B.
Well, that's what they would like, but I'm of the opinion that there's no legal right to pass over. The easement doesn't have a survey of our reference plan of other parts of our property. It's got that piece carved out, that's it.
But it's not an argument about whether they could drive all the way around and use it.
Well, there may be an argument, but
Okay.
that's a separate topic.
Thank you very
The
much.
issue starting out is that we attempted, before we even got here, to sit down with them, all at the same table, and work out that issue before we spend a bunch of time today, not totally prepared for some of the issues, because, again, even last week, we were trying to figure things out and sit down, and now I'm presenting before you, and if there's any type of suggestion that there's a right-of-way and that there's 50 parking spots there on a piece of grass with a fire hydrant and some trees, that's not factually true.
Councillor Huffman and then Councillor Martin.
Thank you, Mayor Chop. Through you to Mr. Nunn. It's getting a little confusing here. So first off, I'm going to go back to an original statement that I made with Mr. Rowe. They don't need permission to put in 16 apartments.
Correct.
Okay. So there will be parking. People will be utilizing parking. Will it be the municipal parking, or are we just strictly talking about the easement piece?
We can't obviously object to them using the municipal parking.
Okay.
There will be issues if there's an attempt to use the easement, the extent of that use.
I would see the municipal parking being of a bigger issue, because if the residents of this, let's say the 16 units, because we're going to say that can be a given, that's taking up parking spaces that people utilize to go to the antique market, because I go there quite often, and that's where people park to go in there. So there's no jurisdiction as to whether the people who are renting these apartments would be able to use that parking or not. So I'm unclear as to what's the bottom line in terms of there's this property that's available that I do kind of agree. I would see 50 vehicles in there as a little bit, that number seems a tad high to me. But if we leave it with the residents who are living there, they drive around, they go down Alice, they go west on Alice, they go south on Wellington, and then they access this spot. Is that going on any of your client's property?
That is my client's property, yes. That is my client's property that they would be accessing. See, my client, I'm emphasizing the easement because that was, just to get that out of the, right away, that issue. There are more issues, but that's a predominant issue of access through the back of my client's property. If you look between the buildings, there's a narrow pathway.
There's a walkway. Yep.
A walkway.
Yep.
When the prior tenants of Claire, I'll just call them Claire, the legal occupants up top of the other building, they were, what my client had to go through with 11, and this is going to be multiplied many times with 20 if that's permitted, garbage, debris.
Okay, but the point is that there's 16 anyways. What we're discussing is the possibility of 20.
Absolutely, but
so I don't understand all of the arguments when we're talking about garbage and things like that. We're not going to. You can't tell me those extra 4 are going to make all of the difference in the world. So they're still permitted to put in 16 units.
But how are they? If there's any talk, which there was before I came up here, of someone having. We've got plenty of parking. The wording was 50 parking spots back there. That might be.
Councillor Hoffman, if I could, he's arguing that there's a potential that they may not be able to park on there at all.
And plus, how do you access it?
And the access piece. So what you're asking for, though, is much like I'm suggesting, there's a negotiation here with council over the parking spots. You would like to have a negotiation with them over.
And that should have been done before we came today.
Gotcha. Okay. So if we could carry on, we'll come back. Do you want to touch on your, so Councillor Martin, do you have another point? Okay.
So
If we could get to the next issues, I'll get you on the parking. We're going to look into it.
Okay. So what is happening in Waterford, according to my client, and I can attest it somewhat just being in the area, is that there's a whole group of new businesses coming in. And to name a few, there's Brush, the Floral Design and Decor, the Waterford Girl, Nifty Gifty, Ritzy's Cakes, Board and Fitness, Ellis Street Antiques, another antique place just down the street, Cornerstone Counseling, Waterford Farmers Market, Fishing, Musician, and Quilt Junction. There's this whole type of almost like a boutique businesses coming in. Waterford's very much becoming a tourist town, or if it already was before, but it's more so now. And what you're getting, similar to Port Dover and other areas, is you're getting all these unique businesses coming in. My client tracked the tourist hits on the internet, and there's hundreds of them, and this goes back in 2019, but the point is, there are all these new businesses coming in. If you take our business, because it negatively affects our business the most, and if it's suddenly commercial, then residential, and then way down is commercial again, we're sort of disconnected from those commercial establishments. There's been the suggestion that there was an attempt to try to rent that space. My client advises there was no for rent sign out there. I would think at the very least that would be a means of attracting people to, here's a possible place to rent. My client had conversations, again, past 2 years with Mr. Gibbons. There was never any suggestion about renting it out or finding a spot, knowing that we had all these objections going back 2 years. We can't stop the 16. We know that. The zoning bylaw is what it is. But if that front piece is removed from commercial use without a real attempt to get a commercial tenant in there, we're basically locked from the downtown. That's not an exaggeration. Our parking aside, the municipal parking is going to be an issue. And if antique clients have to go way down to the right on that map, which would be to the northeast, to find parking, it's quite a ways down. So they're going to prospectively have my client's business suffer as a result. That's not an exaggeration. People will not stop if there's nowhere to park. And if there are 20 residential tenants in there, 16 we can't help, then there are more parking spaces that are going to be taken up. People park, they have night shift, whatever. There will be spots during the day that are going to be taken up. that will affect us.
I ask you a question.
Sure.
So if you had, I agree with you 100% that that's the reason that, you know, bylaws were written such that you have commercial space on main floors. I agree that that's one of the most beautiful spots in Waterford for there to be a commercial space. I agree that, you know, they want something, and this is where I just don't, I get my back up a little bit when it's like, well, it's no big deal, just, you know, pass this cuz. It's a negotiation all around. And so we know that there's going to be 16 units based on the way that our bylaw is written, that we can't help with parking, that could be parking. If it was such the case that they couldn't park over the easement, it would be in municipal, taking up municipal parking spots. Up to 35 cars. Now you've got your business there, and you're going to have to deal with 35 cars in the municipal parking spots, plus the 4 commercial units on the main floor, or however many commercial units on the main floor, right?
Correct.
One option. The second option is, well, you guys work together and you find a way to be able to accommodate cars on the easement, and council ends up looking to potentially, you know, give them what they're asking for, which is the residential units on the main floor. The third option, of course, is the easement, parking cars, plus it stays as commercial. If it was just between the first two options, though, which would you prefer? The 35 cars parking in municipal spots, or 35 cars parking in municipal spots with commercial on the main floor?
Well,
or no cars in municipal spots with residential on the main floor?
Well,
If it was a matter of, I'm not saying those are the only two options, I'm just
yeah,
asking.
I'd have to speak with my client, but the easement, if there was the recognition of them taking up all the municipal parking, then there'd have to be some release of that easement over our property. So that there's no means of passing over our property. We can talk about all we want, but it is an issue, the garbage. I put myself always in the shoes of my clients. If I own that Waterford Antique Market, it's all fine and dandy, and it's all this talk about in the one report, comment from the circulated report from the county was that it increases revenue. It's a lot more than just revenue. If I'm owning that Waterford Antique Market, and I have the experience that she's had in the past with 11 tenants, it's not being discriminatory against tenants. It's just possibly multiplying that problem. We don't know who's going to own this building. We're talking about this as all being imminent, and that we got to get this moving so that the project continues. Mr. Gibbons had this property for sale recently. We don't know who's going to buy it. We don't know what, so we're speculating, unless Mr. Gibbons is doing the development directly, we're speculating about what type of tenants we're going to get in here. We're speculating about the rent. We don't have that information. If he says we do, I'd like to see it, because we haven't been provided with that information. So we don't know, it could be someone from Toronto buying it and base market rent, and that's not a discriminatory comment. It's my client having not 16, but 20 people dumping couches in her backyard. That is an issue. It's an issue when
Okay, we've covered that issue, on to the
Yeah.
next issue.
Yeah, okay.
Is that the last one?
That's fair.
We got to, normally we're limiting kind of 5 minutes here, but we've interjected with questions. So just if you can bang off your last couple of.
Yeah, all right, so we've covered about the parking and access are significant issues. Right now, we don't have use even of the sidewalk along the front of the applicant's building, because it's all corridored off, because there's falling bricks and everything else. So we're already having business interruptions from all this. What I'm asking council to consider, I think we have to put this off. I think that's the fair approach, and I think that there has to be the applicant, myself, and his agent, and my client sitting down and dealing with some of these legalities before we can say we'd agree to this scenario or that scenario, and deal with these access issues, and then come back before council and make further submissions at that time. I think that would be appropriate.
Okay. Any questions from the committee? Thank you, sir. Does anyone else wish to, Mr. Rowe, we're going to finish with everyone, and you can have a chance at the end. Does anyone else wish to speak in general or in opposition to the application? Anyone? Okay.
glad to be back. Just a couple of things. There are ways to solve potential parking issues. If the concern of the neighbor is all the parking spaces are taken up by the residents of my client's property, one very easy solution is to put 2-hour parking on the south side of Atlas Street, that, at least during business hours, and that would guarantee that our customers would have, I counted up, I think, 11 parking spaces right in front of her business if that were the issue. The other potential would be to deal, if we cannot reach any kind of agreement with the neighbor, would be just to provide money to the county for 4 additional parking spaces to accommodate the 4 apartments, and have the county provide that parking in the municipal lot across the road. I mean, there's more than one way. It's frankly often easier to deal with the municipality than it is with a neighbor under certain circumstances. I know my client has done his best to try to deal with the neighbor. Even if he's in Arizona, we can still have a meeting and we can have him on the telephone or on a video. I mean, there's all kinds of ways of doing that. The issue really is just getting back to, is council willing to support 4 apartment units in lieu of a commercial space? Aside from the parking issue, there certainly is room to negotiate with that. I have no issue about that. That is very doable. So other than that, I think we need really to focus on the purpose of the application.
I agree. For myself personally, I can't, I agree that there is a significant loss of taking away that commercial base on the main floor. And it doesn't seem like a big deal right now because Waterford's struggling. And I agree that putting more people is absolutely beneficial to Waterford, for sure. But at the same time, the thought of having 30 to 50 cars parking in municipal parking in that area without a plan, and I don't think it's just a matter of paying Norfolk County for 4 spots. I mean, you made a suggestion while you were up there saying, we'll buy a municipal parking lot. Like, you do want something, and there is value to giving up that commercial space on the main floor. So my hope was just that you guys could speak and try to iron something out on the parking side of things with the easement and have a conversation in the next couple of weeks.
There will be a way, but I mean, ultimately, it could well come down to, we just go ahead with the 16 units, we block off the commercial space, and we just leave it at that until...
Well, all developers, I think, to be fair, most would rather have all residential, right? It's easier to rent residential than it is commercial. I mean, that's nothing new.
Generally speaking, that's correct.
Right.
Yes.
So there is a benefit to that.
Yeah.
It makes it easy going into the future. So I'm just... we see a willingness from him to sit down at the table. You're available in the next coming weeks?
I'm very available. I'd almost like to provide council with copies of emails at the last hour saying, can we please sit down?
I don't need that. It's fine.
No, we're not getting into that.
So, okay. But we're going to have cooperation now, and you guys are going to sit down and have a meeting and figure out some parking.
I'm not going to get into who said what to who. I don't think that is
I'm not worried about it either.
And nor is it, should we go down that road. So,
Councillor Martin.
Thank you, Mayor Chop. I do have one final question for you, Mr. Rowe, while you're standing here.
Yep.
Are you able to comment on the status of the sidewalk? Because I think one really great way to start to work with your neighbor would be to encourage a nice clean sidewalk for people to get down to her store. So is there some type of construction going on right now, or?
The sidewalk should be done as part of the building, and certainly an improvement in the sidewalk, and also the height between the street and the is quite high, is my recollection. So there is room for improvement along the facade and along that sidewalk. Absolutely.
Councillor Barbosa.
Yes, thank you, Madam Mayor. And am I correct in my understanding? This is a public meeting. that we will receive the information that we've discussed tonight as information, and it will be 2 weeks from now at our council meeting that we're actually going to decide whether this gets approved, denied, or deferred.
Yeah, that's correct.
So there is 2 weeks of negotiation space available that hopefully they can come back arm in arm and say, we worked it all out and this is what we think we could do for council.
I think that's great.
Yeah. The only caveat on that is that staff still have to have time to prepare a report, so, and get it onto your agendas, and I know that is much tighter time frame.
Well, it seems like there's an appetite from council that there are some concerns about the parking. I have heard concerns from business owners. I'm certainly willing to consider the residential on the main floor. I get that you don't have to provide it for the 16 units above, but if you want the 4 on the bottom, again, it's a negotiation.
Absolutely.
So, that would be kind of where I would sit on the other side of the negotiation.
Sounds fair to me.
Okay. Councillor Taylor or Paula?
Just to indicate, there's no actual obligation to bring a report back in 2 weeks. If it is the wish of the applicant for more time to negotiate such a resolution, it is an option.
Absolutely. Thank you.
Okay, so if I, okay, you guys need to work that out. That's not for council. If I could have then, I guess there's no actually even receiving this anymore. I don't know why you have that on there. Are we doing that again? Okay, if I could have a motion to receive this information, Councillor Van Passen, seconded by Councillor Michele. All those in favor? And that's carried. And if I could have a motion to adjourn the public hearing, Councillor Martin, seconded by Councillor Geisens. All those in favor? That's carried. Thanks. Should we take a break? Quick break? Thanks. I got waved a finger to hang on a second, but, and we also need to just declare any declarations of pecuniary interest, but is council okay with us, I should say, let's do this formally here, sorry. I'd now like to open the special council meeting, and are there any declarations of pecuniary interest? Okay, seeing none, if I could just have a motion that we amend the agenda to deal with item 3, I guess, prior to item 2. Councillor Rabbitt, seconded by Councillor Van Passen. All those in favor? And that's carried. So item 3 is communications from Mary Cahill, Chair of the Heritage Committee. This is before us today as the county has a requirement to deliver a final answer on this matter within 90 days. Is there any discussion on this? We're starting with item number 3, the correspondence from Mary Cahill in regards to the response to the de-designation. Councillor Van Passen.
Thank you, Madam Mayor. I'd like to say thank you to the Heritage Committee for looking into this issue very quickly, but when I read through the letter, I don't see anything in there very specific that there's something great and special about this particular property that would stop us from de-designating it. So I have, the clerk has a motion there that I think it's already signed, but I'd move it if the original mover doesn't want to.
It was actually moved by yourself, and I see it's seconded by Councillor Michelli. But Councillor Michelli, would you like to speak further?
Yes, thank you, Madam Mayor. I'm a bit confused. I spoke with the clerk earlier, and he told me that we could not pull this item for discussion, and now we're having it. And that's fine. But in any event, and again, I'm not referring to our decision or this particular letter in specific terms, but I think that just for sort of council's education, I'm anticipating that very relatively shortly we will be receiving some communication from the Heritage Committee just to inform council perhaps and make them more aware of what the actual process is for this and when time limits, the 90-day period actually does begin. I think there's been some perhaps unclear steps taken perhaps in some cases and I do not have any trouble again with the de-designation. We had our vote and that and council's will is council's will, but I do think that council members perhaps I hope will be a little bit more informed when we are faced with the next one. That's the point I want to make tonight.
Okay, so the motion is moved by Councillor Van Passen, seconded by Councillor Michelli, that the correspondence of the Norfolk Heritage Committee be received for information and that council direct staff to present a de-designation bylaw for 750 Villanova Road upon the grounds that no unique details of significant heritage value that are not present in many other homes from the period were identified. Any further discussion on that? Councillor Taylor.
The discussion isn't so much towards the motion. It's more so, Councillor Michelli, when you say that there's the process is readily available, and I'm just wondering if that process is outlined on the website, or if you know, or if we could get some further clarification on that at the next meeting, if that process of what the de-designation actually looks like is available for us.
Thank you, Madam Mayor. Through you to Councillor Taylor. Yes, it is available on the Ontario Heritage website. There is actually a series of flowcharts that indicate how the process works depending on what the circumstances are and those kind of things. I'm sorry? I do not believe it's on the county website, no.
Anything further? Okay, all those in favor? And that's carried unanimously. Now turning back over to item number 2, which is staff report PW 20-17 in regards to the Port Dover water treatment plant award of contract for the clarifier replacement. And I believe that should be engineering services.
Thank you, Madam Chair. Through you to council. What you have in front of you here is a report that has, I guess, a few purposes at this point. Number one being, as the title suggests, the award of engineering services for the clarifier replacement. Essentially, the reason that we brought it here tonight is to have a sole source award to WSP, who is the engineering firm who has been doing a lot of the work within the Port Dover plant. The purpose of that being it is to expedite the rate at which we can get that engineering design underway, a tender issued, and this clarifier issue resolved. Second to that, you'll notice in the discussion section there's a kind of an overarching highlight of some of the issues relating to water that were highlighted in the Integrated Sustainable Master Plan. Being the new council, even being a year in, it's still whether you've really been acquainted with the Integrated Sustainable Master Plan or not was kind of one reason I wanted to give a little bit of a highlight to that, and at least kind of bring forward the fact that we do have long-term water concerns in Norfolk County, not just the immediate one that we're looking to address in Port Dover. Some of this does actually tie back nicely to the public meeting earlier with regards to the source protection plan and reliance on groundwater, and though that is kind of something that highlights some of the other, not necessarily intangible, but harder to quantify effects of being a groundwater-based water supply. Further to that, what we're looking for as well is that as we continue down the road of our interurban water supply study, which is intended to provide that long-term vision, long-term solution for Norfolk County's water systems, there's a few other key components that should be factored into that study. One of them being a rate review, basically in order to properly quantify the costs of what it may cost the residents and this county and to connect to, say, a Haldeman system, is we need to know what effect there will be on those water rates. So that study has actually been initiated now in conjunction with Haldeman County, so that they can do some projections as to know that if we do partner with them for a countywide solution, what would that actually look like to us as now a water customer as opposed to a water producer. Another part of this was to kind of just highlight the fact that this council does support Haldeman and Norfolk staff working together to do what we can to expedite any processes that are required. If EAs are required, that it's clear to both the residents and councils within Haldeman and Norfolk that we're all willing participants in these conversations right now, and that everyone has that kind of sense of security that we're trying to do what we can. The second part third or fourth part, I guess, is that as we continue to feed information into the interurban water study, the Integrated Sustainable Master Plan may require to be updated, because one of the preferred solutions of that Integrated Sustainable Master Plan was to look at our water systems within Norfolk County and do appropriate investments in all those sources, or look at perhaps partnering with an adjacent municipality. So because that was a council-adopted document and it is a master plan, there may be a requirement to have an update to that plan done based on the findings of the interurban water supply study. Therefore, we are also recommending that council permit a sole source or a single source award to the MMM group, who were the original authors of that Integrated Sustainable Master Plan, so that should any updates to that be required, we can get the same group that did the original report involved. It's typically quickest and easiest for them to provide amendment to their document than to bring in another engineering team to basically revisit the entire thing. One thing I do have to note is in the previous budget deliberations, there was an approved project under the financial services section for a Norfolk County water and wastewater rate study. Through conversation with the way things have changed over the past and us looking at alternative solutions for water supply across this county, it is staff's recommendation that our own internal Norfolk County water rate study not be completed until later in the fall, once the interurban water supply has been presented to council and firm direction on the long-term vision has been going, because if any decisions made at that time drastically change our existing operations, it would have a massive effect, or could have a massive effect on the outcome of that, our own rate study. So our recommendation is at this time that just be delayed. All of that being said, if there are any further questions, there's a lot of content in here, so if anyone had any concerns or questions, I'd be glad to discuss further.
I guess, Jason, the first thing, could you touch on right under the paragraph about Simcoe? It states that some of the known some of the known water quality issues in Simcoe include sodium levels which are greater than 50% of the maximum allowable concentration, a trend of increasing nitrate levels in the source water due to proximity to agricultural areas, threat of contamination of the Cedar Creek wells from known groundwater contamination in the area of Norfolk County garage, and high iron levels. Can you speak specifically to how high of a threat this is, and I guess if there's any sort of timeline into how long we have to really, before Simcoe is an even greater concern?
Through the chair to council, I can't really elaborate too much specifically on the exact urgency of some of those issues. I know that community of Simcoe's water supply has historically been higher in sodium. That is something that we work with the health unit on. We have annual reporting requirements on that. We have not been experiencing a significant amount of water quality, anomalies as a result of the contamination issue in the garage area. That is within our Cedar Street wellhead protection area. The efforts of this and the previous councils to get working on the remediation has kept that concern at bay. The nitrates, I have not looked at the data lately, but if you go back, if you wanted to reflect back onto the source protection mapping that was provided during the public consultation or public meeting portion tonight, you noticed that big swath in Simcoe kind of to the northwest, within that there was a hatched area which they called the issue contributing area. And what that is where they know based on our groundwater monitoring that there is higher than normal nitrates in that water. So that's why it's identified as a zone of concern where we need to be more cognizant of nitrate loadings that happen in those areas. That is, I believe Simcoe is the only one that's affected with that. And on the iron, I can just quickly basically state that there's a lot of naturally occurring iron within the groundwater in this area. And basically what it does is it wears out our pumps and screens and everything within the actual wells themselves, and that's why we talk about annual rehabilitation costs and the fact that a well that, for simplicity's sake, used to produce 10 liters a second, it declines over the course of a year. We do a rehab on it, we might get 9.5. And then it declines over the course of a year, and then we might get 9. So we're into this point where the performance and pumping capabilities of these wells is also on the decline. Fortunately, we do have sufficient capacity in Simcoe, and that's why a lot of this can be handled through treatment activities. However, when we're talking about the long-term sustainability of the water systems in Simcoe and across this county, there are these concerns that we feel need to be addressed.
Okay, so just, I guess more specifically, just because this one in particular has an actual figure and a number, the MOE sets these regulations, correct? So the MOE set a maximum allowable concentration of sodium. But we are operating at more than 50% of the maximum allowable concentration. So obviously the MOE is aware of this then?
Through the chair, that is correct.
What's the purpose of setting a maximum allowable concentration if you don't meet the maximum allowable concentration?
Through the chair, it's something that from the drinking water quality standards, there is the absolute maximum that you can even permit and basically serve to people. But there's also language in the regulations surrounding once you get to a certain threshold, which is why they call it the half max, so that 50% of your maximum allowable concentration. It just triggers reporting requirements. It's basically just about keeping the public aware of what is in their water and what is out there.
And has the MOE had any specific concerns that council should be aware with Simcoe and or Waterford that sort of articulates that there's no redundancy that's been built into the system with the risk of the wells being contaminated?
Through the chair to council, there is not that I am aware of. They have not specifically identified those through an MECP inspection report or any other directive that I've been aware of. However, they're always in these conversations with us as the operating authority and they do recognize that these potentials exist. However, they've not issued any kind of order or directive for us to do something about those at this time.
Council could just humor me here. So if you were to build, I think it would be generally safe to say, correct, that any new facility would have to have redundancy built into the system. That under current regulations, likely something like this wouldn't have been allowed to have been constructed in such a manner.
Through the chair, I would have a tendency to agree with you. I could not state that exactly. I know from an engineering standpoint, you would always be looking at how to build that extra redundancy in. In theory, if we were starting with a clean slate, we would be looking to be getting water sources that would not be subject to these concerns.
Further questions from councilors? Councilor Van Passen.
Thank you, Madam Mayor. It's not really a question, it's a comment. I was just a little bit surprised with the date of February 4th, 2020, because I've read reports all the way back to 2006 that more or less say the same thing, do the same things for the same reasons, so it's not a problem that just magically appeared overnight.
Sorry, and then Councilor Roberts.
That's okay. Thanks, Mayor Chop. Through you to Mr. Godby, specifically dealing with the repair to the clarifier in Port Dover. What does that look like as in terms of a timeline and rollout? I've had lots of community members ask and business owners ask. What would that look like moving forward?
Through the chair to Councilor Martin, give me 1 second here, and I actually have a bit of a project schedule here. We're looking at with a award, the single source award tonight of being able to engage WSP, they can get the detailed design work completed for the clarifier replacement. By the time we go through approvals and tendering, we're anticipating construction starting around, I would anticipate that to be September of this year, that we would be in a state where we would be taking the existing clarifier completely out of service, be operating a temporary filtration plant for the clarifier, and having the new clarification units, which are they're called a DAF unit, a dissolved air flotation, basically up and running into the, well, we're projecting Q2 of 2021.
I know we don't have a camera volunteer tonight, and that's probably a great thing because I just had to shovel my chin up off my desk. I'm shocked. Thank you for that information. So this temporary filtration plant, like specifically, what does that mean for community members who go to the water plant as a means of business to fill up a truck and then service the rest of the community? What does that temporary, how do I explain to them the next steps from a business perspective?
Through the chair to Councillor Martin, it would be staff's recommendation that we continue that the Port Dover bulk water depot remain closed until such a time that we actually have capacity increase within Port Dover, which is totally unrelated to this request here about clarifier repair. Just for clarity, the clarifier repair is to ensure security of the existing supply at our existing capacity levels. A capacity increase is not included in this.
Thank you, understood. So if all goes well, second quarter of 2021, it'll be back open for regular use.
Through the chair to Councillor Martin, no. No, this is just to address the clarifier.
Not capacity, just the clarifier.
Yes, the clarifier will be addressed, which gives the existing plant in its current state the ability to continue to operate.
Sorry, understood. Got it. Thank you. My second question is with regards to the study at large. Next steps and how long does a study like that take, and when can we expect to hear an update again?
Through the chair to Councillor Martin, we are currently we have a number of moving parts going on at this moment. We've been meeting with Haldeman staff about their rate study, which is kind of a joint venture, so we understand what is happening, what could happen to the rates in the long-term future should we go one way or the other. That information gets plugged into the interurban water supply. We are currently working on some additional engineering analysis of what would be the impact from a purely engineering standpoint of running a pipeline to the Nanticoke Water Treatment Plant. What would it be required within our own Port Dover system? Would there be booster pumping required? Would that trigger EAs? Would there be pressure relief zones that needed to be made based on the fact that we're changing the overall dynamics of the water system? So that's kind of on a 3-month projected timeline there. That information also feeds back into the interurban supply. Right now, we're realistically looking at approximately 6 months in order to come back with a firm recommendation as to the long-term solution for water for the entire county.
Shelley. Oh, sorry, Councillor Martin. Councillor Shelley.
Thank you, Madam Mayor. Jason, my question is kind of connected to, I think, the first response that you gave to Councillor Martin about the engineering firm WSP, and in your report you're indicating that we should use a single source supply approach to WSP because, first of all, I assume that because of the timely nature of this project, is that part correct?
Through the chair to Councillor Michelle, yeah, a little history on that was WSP was originally retained to do some engineering in that Port Over water treatment plant dating back to 2017, where we first started looking at a capacity expansion at that time. Unfortunately, things had changed to the degree that the clarifier became a more pressing issue, and we've had to kind of switch their focus over to that. So their familiarity with the plant is one of the primary drivers of that, because they are able to respond quickly to our needs.
Thank you, Jason. So as a follow-up to that, so also in your report, you indicate that as a result of what you just described, we will incur reduced engineering costs because of their familiarity with the project already. Is that correct?
Through the chair to Councillor Michelle, I would assume that would make a point of it without actually having seen an additional proposal of the works. I can't confirm that for certain. However, I can say from a timeliness factor is with approval tonight, we can get a project initiated and kicked off with them as early as tomorrow, as opposed to going through a multi-week RFP evaluation process, which would put us behind probably another 2 to 3 months by the time we went through all that.
And the reason I bring this up is that I'm always just a little bit, and council has in the past received these unpleasant surprises that, the engineering firm, I'm always just kind of concerned. They know our situation. They know that they are the only provider, and I'm just always a little bit nervous about whether or not that will inflate their final bill to the county.
Councillor Rabbits.
Thank you. Through you. My question is regarding the sodium content of the water in Simcoe. In the 4.5 years that I've lived in my home, I've only actually received one notification by mail, and I do believe it was from the health department. Jason, I'm not expecting you to answer this question right here today, but I would like to know in the future if you could report back to council with the help of our health department what triggers that notification or that letter to be sent out. I know it was sent out to quite a few households on the west end of Simcoe. I imagine that the hospital would be on that same water line. And I was sort of, from the public's perception, when maybe they might have got onto it or were notified, or maybe they weren't aware of the high sodium content of the water until such a notification came out. And it seems that if it got to that point, there must be a significant amount of sodium in that water.
Through the chair to Councillor Rabbits, that is a ministry requirement that we report every 60 months, okay. So every 5 years. So if you got it about if you've been there 4.5 years and you just got it, you can basically wait another 5 and you'll get it. It's been a regular reporting requirement that we've had in Simcoe, honestly, for as long as I can remember. So I've been through at least 10 years of those sodium reports going out. It's something we always do in conjunction with the Haldimand Norfolk Health Unit for our messaging. As well, for the interest of council, you will be seeing likely in the next month or month and a half, our annual drinking water summary reports get presented to council, which is basically our high-level overview of the previous year's events and water quality analysis. A bit of water quantity analysis goes into that, and it's kind of just the general overview of the health of our water systems. So that will be coming. One of those reports to the province is due the end of February, the other one at the end of March. So we usually time our presentation to council somewhere in this next month and a half.
Wow, thank you for that, Jason. That does provide quite a bit of context. So for the public's understanding, it's not necessarily something that happens year over year or based on an incident or a bad reading. It's all part and parcel of the regular reporting requirements, and that's roughly on a 5-year time cycle when those letters are issued to residents that have so high sodium levels. A follow-up question is with regards to the iron content in the water. I think it might be beneficial for residents maybe to receive a little bit of information of what they can do with the pipes and the water treatment in their own homes. I imagine that if you're having pumping issues on an industrial scale, that might be worthwhile for residents that might be having some issues with their own home, water filtration or water regulating system that they're also probably losing capacity or pressure with the high iron content. I'm not too sure what high levels of sodium does to a water system. I'm not very familiar with it. It might be a good piece of a public service announcement to say if you're experiencing a loss of pressure or if you're experiencing pump failure, this may be a contributing factor. Maybe this is a way to mitigate that by regular maintenance. I think that would be worthwhile. I'd be interested in. I'm just thinking about my pumps and my stuff at home now. My home was built in 1979. I'm sure it's had a number of years of this type of water going through it, and I 4.5 years and haven't had to have a major repair like that. But I think that'd be valuable information for the public to have in Simcoe here, where we're facing the high iron content and the high sodium levels.
Through the chair to Councillor Rabbit, so I think that could be a good idea. We do try to put some of that type of information on our website. I don't know if it goes into that level of detail, but it's definitely something we can work with staff on getting more information out there, what other things that homeowners can do when they're experiencing issues. Just as a side note on that, just for clarity, the high iron levels are primarily found in the source water, and the bulk of that is removed through our treatment processes. However, there is always still some of that residual within the water. So it can compound over years and years, just like anything, but we can definitely work on getting some more information out.
Councillor Taylor.
Thank you, Mayor Chop, and through you. I'm wondering if my colleagues around the table here would have the appetite to perhaps send this report along to Minister Scott's office, maybe with another well-worded letter, just to make sure they're still thinking about us over there in the Ministry of Infrastructure. Any thoughts?
I'm not sure that Minister Scott needs the report, but I was just thinking, I was actually going through my phone trying to find a Facebook message from Mr. Toby Barrett that suggested that the water situation here in Norfolk County, that we should, instead of worrying about Port Dover, we should focus on Townsend. I think it's pretty clear from this report that we have a serious water issue across Norfolk County now, actually, not just Port Dover. And I think perhaps maybe a letter without the report itself to Mr. Barrett's office again, looking for assistance at this matter. Unfortunately, he did send his assistant, who arrived quite late, but did arrive eventually to the meeting with Minister Scott. But Mr. Barrett himself did not attend. So I think this needs to be elevated in importance to the province. I think we see other municipalities getting discretionary funding, and the time for Norfolk County to be able to wait for the next green stream to open is not realistic. We have to start moving on this now. And, we just did raise water rates 16.8%, and that doesn't include this solution. It includes the clarifier, but it certainly doesn't include addressing the problems in Port Dover, Waterford, and Simcoe, and then on into Delhi. It's interesting when we spoke with had various delegations at Roma, and even speaking with the Liberal Party, they said access to safe drinking water shouldn't be a partisan issue, and it's pretty hard to believe that in today's day, here we are in such close proximity to the Great Lakes, and we are still servicing most of our residents on well water. And now we're understanding that in Waterford, there's 2 wells that are 55 feet apart in the same aquifer with zero redundancy built into the system. In Simcoe, we're about to experience significant challenges. We have been already, as wells are starting to dry up. So I hope that Mr. Barrett, after reading this report himself, might begin to understand the importance of this issue to Norfolk County and its residents. Councillor Martin.
Thank you, Mayor Chop. And I think really, we've really spent a lot of time separating our infrastructure issues here in Norfolk County, and including the hub from water and the water from hub, or a bridge or a dam from water, and so on and so forth. But I think that we could articulate to Mr. Barrett that it's an infrastructure issue at large. If you think we're gonna think about taking water and driving it through the trail line like we've always discussed around this table, and other councils have as well, to feed all of Norfolk County, it's a major infrastructure issue that's going to potentially cross right through the community hub piece of land. So, but that's actually neither here nor there, because my question, I want to go back to the bulk pickup. How am I going to explain when landowners and people are paying their bills, the bill has gone up because the truck is going elsewhere? How am I going to explain to those individuals who are serviced by the bulk pickup and the business owner that I don't disagree with it, but how am I going to explain to them that we're not allowing them to go there anymore when they have been going there? Was that not part of a calculation prior to the capacity?
Through the chair to Councillor Martin, the fact, the usage and amount of water that had been pulled out of that bulk depot by the haulers was always included within those peak demands as well for the system. I guess the biggest thing is that we have the ability to turn that tap off and redirect that truck traffic to one of our 4 other bulk water depots. Port Dover is not the only place to buy bulk water. It's the same rate for the water itself if you go to Waterford or if you go to Simcoe, Delhi, or Port Rowan. I do understand and sympathize with the fact that it does come with increased trucking costs, and that's going to ultimately have an effect on the business owners who run those, as well as the property owners who are going to ultimately incur more shipping costs and to get the water delivered to them. However, that is a controllable amount of consumption, amount of water being pulled out of the Port Dover water system, which we believe we need to stop doing in order to help mitigate the other potential threat there of over-consuming the available capacity of that system.
Councillor Roberts.
Thank you, and through you, I would just like to comment that I am in support of prioritizing getting some water into Port Dover. I think it's a long time coming. Those that have been looking at the information know that we've had staff reports going back to 2006, as was indicated by Councillor Van Passen, and we've had quite a bit of studies, and it sounds like we have a pretty good handle on where we have gaps in the system. So deferring that water study, it's something I would also support. I think that we need to focus our priority on intermunicipal partnerships with Haldeman, getting water into Port Dover, fixing this clarifier, and eventually bringing that water up into Simcoe and into the other urban centers that serve the larger populations in Norfolk County. We've known for some time that we need to get off the wells here in Simcoe and across Norfolk County. And I think this is one of those circumstances where we've run out of road, right? We've kicked the can down the road so far where we finally hit a place where we're starting to have capacity issues, water treatment issues, and with the amount of infrastructure that we have, it isn't sustainable. So if we're going to prioritize direction and move forward, I would say focusing on that intermunicipal partnership with Haldeman should be number one, in addition to addressing, the end of the line here in Port Dover. I know we've discussed where we're going to be piping that water through. Lynn Valley Trail is something that's been discussed, roadside. Want to have that dig once policy in place, but I don't know if it's something where we'll be having exposed pipe. I know it's a lot easier to service, but it also degrades a lot further, right, with erosion and weather conditions. So those are things that I think we'll need to address in our future water study, but that's going to be taking place well after we start, getting through these priority items and working with Haldeman. So I support the staff recommendation. I just wanted to articulate that and verbalize that. So I think that's the direction we need to go in as a council.
Just a quick question, Jason, just reading the motion itself. The second to last, and further that Norfolk County Council supports the collaborative efforts of Norfolk and Haldeman staff in completing water rates and other studies. Would it be worthwhile at that point to add water rates, engineering, and other studies, just in the event that you...
Through the chair, to the chair. I would say that we could add that in there. Part of the original thought process when we were drafting that together was to capture the water rates. However, we also just wanted to throw in the other studies in case something like that came up with an engineering study. We would kind of just lump under that. So it wasn't necessarily, we could add engineering in there specifically. My interpretation of that would have been inclusive of other engineering studies as well.
What about any potential other engineering design work that you might want to move ahead with?
To the chair, that could be an advantage to have that leeway as staff to be able to exercise that without there being any confusion about what we're doing. So I would agree with that.
And then the other piece is just learning. I had a conversation with Jason earlier that WSP has had some staffing changes, so we're just looking to add as well and further that at the top of the motion, that council permit a single source supply as outlined in Norfolk County Purchasing Policy ECS-02, Section 4.8.4, for the purpose of retaining WSP in order to complete the engineering services for the replacement of the Port Dover water treatment plant clarifier, conditional upon staff reviewing WSP's team. And if there was any challenges, then it would come back to council. That's okay.
Yeah, to the chair and council, we did discuss that, and staff are definitely on board with that.
Any further questions from council? Okay. So, in that case, the recommendation then reads that staff report PW 20-17 Port Dover Water Treatment Plant Award of Engineering Services for the clarifier replacement be received as information, and that council permit a single source supply as outlined in Norfolk County Purchasing Policy ECS-02 4.8.4 for the purpose of retaining MMM Group Limited in order to complete the required revisions to the current integrated sustainable master plan. And further, that council permit a single source supply as outlined in Norfolk County Purchasing Policy ECS-02, Section 4.8.4 for the purpose of retaining WSP in order to complete the engineering services for the replacement of the Port Dover water treatment plant clarifier, conditional upon staff reviewing WSP's team, and further that the interim general manager of Public Works be authorized to execute the necessary contract documents with WSP for the replacement of the Port Dover water treatment plant clarifier in the amount of $425,000 plus applicable taxes, and further that Norfolk County Council support the collaborative efforts of Norfolk and Haldeman staff in completing water rates, engineering design works, and other studies, and further that Norfolk County Council supports the completion of the interurban water supply study in order to provide preferred solutions for the long-term strategy for establishing a safe and secure water supply for all of Norfolk County. Mover, Councillor Rabbit, seconded by Councillor Martin. All those in favor? And that's carried unanimously. Okay, so I think I just need a bylaw here. Bylaw has been moved by Councillor Taylor, seconded by Councillor Michelli, that bylaw 2020-09 being a bylaw to confirm the proceedings of the Council of Norfolk County at the special council meeting held on the 4th day of February 2020 be passed, signed by the mayor, county clerk, and affixed with the corporate seal. All those in favor? And that's carried. And finally, motion moved by Councillor Taylor, seconded by Councillor Martin, that council be adjourned at 6:19 p.m. All those in favor? Carried. Have a good night, everyone. Oh, any general announcements? My apologies. No? Okay. Have a good night.